Hello, am I audible?
Yes, yes, sir. You are audible, sir.
Yeah, shall we start? Have all the
Yes,
speakers?
sir. Yes, sir. Yes, sir. It
Okay.
starts.
Um, According to Indian time, good evening to one and all. I am V. Ramanathan, associated with the Student Counseling Services of IIT BHU. It gives me immense pleasure to welcome you all for this unique webinar where we have professionals from different fields of mental health. So it gives me pleasure to welcome Dr. Ram Shankar Yadav, Dr. Vimal Kumar Sharma, Dr. Sudhir Bhandari, Dr. Anil Sharma, Dr. Lokendra Sharma, and our in-house psychiatry consultant, Dr. Lakshman Yadav. Mental health, of course, is indeed a very unique aspect of our health. Physical disability can be easily identified because of its uh, visible because of its visibility, whereas mental health is something that needs a lot of training from within ourselves to identify whether we are doing good with respect to mental health or not. And more so in these troubling days, in these tiring days of COVID, where all of us are going through a very rough phase of life, very unprecedented way of leading our life. We never thought about it 6 months before. So in this crucial times, it is all the more important that we pay more attention to our mental health. And if I go by the summary or the report of the NIM, of our National Institute of Mental Health, it is very alarming to note that around 150 million Indians are in need of mental health, assistance in mental health. So that's indeed an alarming figure, but in the hands of expert and professionals that we have, we need not worry. And this webinar is in that direction, where we can learn from all our experts how to enhance or how to keep balance of our mental health. So with these few words, I extend a warm welcome once again on my personal behalf, on behalf of my institute, as well as on behalf of the Student Counseling Services. And before I conclude, I just would like to quote a popular verse on mind, as told by Bhagwan Sri Krishna in Gita, that yato yato nischarati manascha manaschanchalam asthiram tatastato niyamyaitad atmanyeva vasham nayet. So it is whenever and wherever the restless and unsteady mind wanders, one should bring it back and continually focus it. And there are methods to focus it from different domains of expertise. So with these, I welcome once again to all the speakers. And I hope that all our students will have a good time in this couple of hours that you're going to spend and you're going to listen to our expert speakers. Thank you very much.
Thank you, sir. Very good evening, ladies and gentlemen. I'm Lakshman Yadav, counseling psychologist of Student Counseling Services, Wellness, IIT BHU, and I'm also today a moderator of this program. Welcome you in today's webinar on topic psychosocial and educational challenges during COVID-19 era and overcoming strategies. If you see the current scenario, whole world is changing due to COVID-19. In such pandemic situation, our social animal is now bonded to follow social distancing. We are more anxious about uncertainty and facing several issues in area of psychological, social, educational, and many more. Everyone is suffering and finding it difficult to deal with such issues. So, observing this above situation, Student Council Services IIT BHU has taken initiative to organize this webinar in association with RMCTA, that is a Rajasthan Medical College and Teachers Association. So, without taking much time, we are moving ahead, and let me introduce our eminent speakers of today's webinars. We have 5 eminent speakers today. Dr. Sudhir Bhandari sir, who is a controller and principal at SMS College, the Medical College and Hospital. The second speaker is Dr. Vimal Kumar Sharma sir, who is a professor of global health research at University of Manchester. We have Dr. Anil Sharma sir, an assistant clinical professor at UCLA School of Medicine's USA. We have Dr. Rama Shankar Yadav sir, who is a faculty in area of human resource management at Indian Institute of Management, Rohtak. We have Dr. Lokendra Sharma sir, who is a senior professor in pharmacology at SMS Medical College, Jaipur. So I welcome you all speakers, all resource persons. And in this sequence, I would like to invite Dr. Sudhir Bhandari sir. And before welcoming sir, let me give a very brief introduction about sir. Dr. Sudhir Bhandari sir is a renowned physician and dermatologist and fellow of Royal College of Physicians, that is FRCP, London, Edinburgh. He was bestowed with Rotary Foundation Fellowship in Diabetes and Metabolic Disease at Cardiff, UK. He has been awarded Fellowship of American College of Endocrinology and a Fellowship of American College of Physicians, that is FACP, Fellowship of Indian College of Physicians, Fellowship of Diabetes in India. He has also published more than 80 articles in prestigious medical journals. So over to sir. Dr. Sunil Bhandari sir. I request Rachel to take us on screen. Am I audible to Rachel?
Yes, sir, you're audible. I think Dr. Sudhir hasn't heard you yet.
I'll request Dr. Sudhir sir, please come in.
Hello. Hello, good afternoon. Can you hear me?
Good afternoon, sir.
Good
sir.
afternoon.
Good afternoon, sir. We're waiting for our speaker, sir, Sudhir Bhandari, sir. I'm connecting him through phone.
Okay.
Due to some technical issues, sir is not able to connect with us. So in this queue, I would like to invite our next resource person, Dr. Ramashankar Yadav, sir.
Mhm.
Okay, so thank you, Lakshmanji.
Sir, let me give a very brief introduction
Oh,
about
sure.
you.
I'm so sorry. Please.
Sir has completed a fellow program in management from Indian Institute of Management, Ahmedabad. Prior to IIM Rohtak, sir was teaching in a Banaras Hindu University, Varanasi. Dr. Yadav sir is an associate editor for Indian Journal of Human Relations and Indian Journal of Social Sciences Researches. So over to Dr. Ramashankar Yadav, sir.
Okay. Thank you. Thank you, Lakshmanji.
Thank you, sir.
And a very good evening to everybody from Indian time. I'm Dr. Ramashankar Yadav, and before starting my talk on the topic, let me extend my sincere thanks to Dr. Lakshmanji, Dr. Ramanathanji, and entire student counseling services and wellness team of IIT BHU for inviting me to share my thoughts on psychosocial and educational challenges due to COVID. I'm very delighted to be here to share stage with eminent speakers who are there here. So a very good evening to everybody, one and all. Now, as we know that this COVID-19 has not only affected us, physically, everybody is concerned about how fast this particular disease is spreading, and in the chain there are lot many variables which are impacting or magnifying the amount of anxiety or stress or distress which it is creating, apart from the disease itself. So one is the physical nature of the disease, which is borne by the virus, and then there are certain variables, whether it is from the government rules and regulation like lockdowns, and which are creating some kind of economic depression, physical distancing, and quarantine, which are further creating a stress or panic situation. And apart from that, you have media, which is creating another infodemic. So bombarding of information without checking what is true, what is relevant, or what is not relevant. So this infodemic is far more infectious than the true nature of the disease. Now, to my students, let me introduce just the topic, the psychosocial component which this particular disease is impacting upon. Now, when we talk about the psychological component, we are largely talking about the cognitive or the thought level changes which are created or which are impacted or are getting affected due to the disease. Now, let us ask a question here, that has COVID really induced some kind of cognitive deviation, some thought level deviation, such as loss in our own attention span or decreased learning ability, maybe not able to concentrate upon one particular thing, and we are continuously drifted upon and not speaking or letting our express the thoughts. So we are, somehow, are we getting into a situation of helplessness because of certain overthinking? So a cognitive issue. Second comes the affective level or the emotional changes which are happening just because of the environment which has been created by the disease, plus all other relevant factors which I just mentioned, whether it is about the social distancing, quarantine, or the infodemic which media is creating largely. So this involves, this affective level involves a kind of personal feeling where you are not able to manage your emotion wells. Either you are very much scared about your death or getting infection from this disease, and I start suppressing my feelings, and I become less passionate about things in general. So let us introspect and reflect, is this really happening, or the situation is really more positive? What is the magnitude? Now, the third component which I would like to highlight is the behavioral aspects. Now, when I say behavioral aspects, largely I'm talking about the attitude which you are carrying, and these attitude are formed through your cognitive and affective component, which play a major role in deciding my behavior at large. Now, if I have some cognitive issues like overthinking of COVID, which again is a deviation from normal thinking process, because in normal thinking process, I do not stress so much upon one particular incident unless and until it is so much changing my normal pace or normal life. But here we have to see that, this COVID is really a kind of stressor which is creating an act of panic or an environment of panic where people are really, having, certain sort of anxiety disorder, or some people, I'm not talking about majority of them, but yes, people, and largely those people who are more susceptible about this disease. So, I think, I overthink, and things, and in general, it induces a feeling which makes me more scared of me and my family member getting infected by COVID-19. And this overthinking, or this, I'm getting scared of anything. And in the act of scaredness, or when I'm feeling scared, what I do normally,
No,
I shout
negative,
out.
negative.
Normally I shout out, yeah, or I'm very much negative, and similar is happening with corona as well, but corona will not go by shouting, but rather I will go back to the resource conservation theory, which says that we have any time and every time we have limited resources, and we have to use it very wisely. So if I am using my cognitive resources, my affective resources, attitudinal resources in wrong direction, which I generally don't control, then probably I am losing on the strategic aspect where actually my control is, right? So this means, fighting with corona has to be very, very strategic, like any other stress condition. And we have to adopt a strategy to reduce negative consequences of this COVID at psychological level, and adjust so that we can adjust well in this scenario. So let me, just summarize, so there are, challenges, there are demands which have upsurged just because of this new variable. It has just entered in our atmosphere. Now, no one knows, and probably vaccine is also, there are some good news that vaccine is coming, but at least it is going to take, 3-4 months to be very optimistic, so that it reaches out to the general public, or maybe the March, April of next year. Now, in this demanding situation, I have to own certain responsibilities so that I can handle the pressure. I can handle these uncertainties well. And for handling or maintaining my responsibilities, I have very few limited resources. And in those resources are my own intellectual resources, which I can channelize in a very positive manner. Second is my social resources, which I'm getting from my family, friends, and other lovable dear ones who are offering me moral supports, which in a way is giving me some positive booster. Okay, so it's about the managing of your resources and not thinking too much about the disease, because it is, you have to accept that this is, so if we go by certain phases, certain times people are in the denial phase, that it will not catch me. And then if you see things have changed from denial stage, you're coming to the acceptance stage. Yes, it can happen to everybody. And now what you have to do is that what is in your control? What is in your control? Number one thing, and as many doctors and other learned experiences have told you, and you might have come across with these, simple steps. But yes, these simple steps are going to be crucial in fighting and in mitigating these risky environment due to COVID. Now, number one is taking precautions and other relevant measure, such as, because once you are taking certain precautions like, wearing gloves, mask, even if you're talking to your friends, doesn't matter. Assume yourself that you are the person who is getting infected, or who is the carrier of the disease. Because once we know, or once we assume that, the chances are very high of getting caught by this disease, you become more responsible. You remember the first point. Now, what does this mean? This does not mean that we are overthinking too much about the COVID infection. But what I'm trying to say is that to be responsible from your end. Second is developing cognitively about the positivity of the environment. Although till date close to 58 lakhs have been infected by this worldwide by this particular disease. But if you analyze the death rate, which is very low, close to 3.97%, and if you further analyze this death figure, in this particular death figure, most of the, or the majority of the proportion is coming from the old aged people who are ideally having some cardiac disease, hypertension disease, diabetics, or other chronic diseases. So this is something you can have a positive cognitive evaluation about the scenario, which gives you some hope that the situation is not so bad as well. So you have to focus on the positive aspect. That's the key. That's the key which we are going to keep with us. Now the second thing is, what else positive you have. So even if you are going in small outing, or ideally you should not go, but if you are going, please wear mask and gloves and assume that you may be the carrier or you can get the disease. So that is sense of responsibility you should have. Plan your groceries, eateries, and daily stuff for 7-15 days. This will eliminate your daily going out to the market and getting caught hold of the disease. The chances increase much. Keep sanitizer and use frequently after any external contact. Drink a lot of water on regular basis, which keeps you, and ideally that water should be lukewarm or normal. It should not be cold. Have some paracetamol tablets and vitamin capsule, which may boost up your immunity. And let us have 1 or 2 emergency contact number of doctors or physicians who are nearby, who are dealing with this COVID-like situation. Okay, and one thing is more important, because we all are students and we all are young. So do 15 minutes, 30 minutes of exercise, because it makes your blood flow on a very normal pace. And majority of the time the experts from the medicine will tell that the majority of the time it is the obstacle of, or the normal blood flow get discontinuous, or there is some disruption in the blood flow, and you get caught hold of majority of the diseases. So make your blood flow in a normal pace. And also subscribe to authentic information. Don't get victim of the infodemic which our media is propagating. They're giving lot of information without fact checking, so which is creating more panic. So avoid that. Subscribe 1 or 2 journals, maybe from NIH, or maybe from ICMR, Indian Council of Medical Research, so on and so forth, or maybe other reputed international level of journals which are actually talking about certain do's and don'ts related to the disease. Okay, now keeping yourself engaged in a positive thing you have to do. The third level, which is the attitude level. How can you, so these were the precautions. One was about the cognitive evaluation of the situation, that is the situation really bad, and what is my responsibility in that. Second was about if I'm in control, what should I do, what are certain precautions I should take. Third is, how should I shape up my attitude positive. So keep yourself engaged in positive work. You are a student, you are in academia, write paper, discuss on ideas with team members. So this will really give you some positive ray of hope. You are engaged in some positive ideas, some positive interaction. Pursue your hobbies which you are not able to pursue, such as gardening or music or playing any musical instrument. Okay, share some positive news with your friends, or do some video chats with them, reconnect with your old friends. This again gives you a sense of belongingness, connectedness with the other people. So this is some social level of resources which you are collecting. So this is social resources collection happening. Okay, and remember, you are young, you are the Mr. Dependable or Miss Dependable of your family. So you have to be more responsible. You have to give authentic information about certain do's and don'ts about COVID, because your elderlies or your childrens are more susceptible to these diseases. So you have to act as the wall, as a barrier between corona and your family, and keeping yourself too safe from this disease. Okay, so now coming to the third aspect of the, fourth aspect, which I would highlight, the educational challenges, which is more relevant to you particularly. The after this particular COVID, majority of the educational institutions have, went online or blended mode. And but there are certain challenges which we will face as student, as teachers, because these online or blended mode learning pedagogies have certain limitations, and they also they also interfere how to make the education outcome based education, because largely engineering, medical field, which involves a lot of laboratory work and practical exposure of things or disciplines or subjects, you need to have certain outcome based education where you can meet the requirements, and you can also measure those requirements or those outcomes from the students. Now, how to do that? So certainly, a field which are like management, which are largely theoretical in nature, or social sciences or arts, there you can, very easily switch. Just like, manufacturing and IT industry. IT industry people can easily switch to the work from home. But what about manufacturing, where social distancing is a problem, and you have to, go really into the field or in the assembly line to manufacture things. Now, what to do? So one is, maintain that social distance with the precaution. And if you're not sure, have some other alternatives. Have some other alternatives. And what are those alternatives? There are certain alternatives like, which are just like, you can say that those simulation based or virtual laboratories, and in science and technology particularly, simulations are largely applied. So now this is a time again where we can recall these, less used techniques, whether it was simulation or virtual laboratory, where you're giving feel to the student about the, although it is not the exact replication of real life devices or tools, but they are the best substitute. And still, I mean, they can be the, they can serve as the, pedagogical substitute. Various companies such as MATLAB, National Instruments, and others, they are designing some web-based cloud services which can foster these simulations and virtual laboratories. Now coming back, so this is something which organization as an institution can help you to provide a medium for learning transfer. Now, there are two other critical stakeholders who are involved in this. One is the student, and that is you. And now remember, in this challenging phase, it largely depends on the learner's attitude, that how much he or she is willing to learn. Because the teachers have limited access, exposure to this technology, because many teachers are not so frequent with this, because they have developed over a period of time, they have developed a kind of teaching pedagogy which is more of direct, where you are getting positive feedbacks or negative feedback directly from face-to-face interaction with the students. And that reinforcement can further help you substitute, modify your teaching pedagogy, so that you make learning more interesting and more fruitful. But here, because of the interface, because of the medium, things are really challenging. So onus lies on the students. Now, what to do? So here are 4 or 5 points, critical points, which students should, understand. Am I audible?
Yes, sir. Yes, sir.
Yes, yes.
Sir, we have time.
Oh, actually, I got a missed call from you, so maybe I thought.
So please check your message. I have left a message for you, sir.
I will take only 2 minutes, okay? So begin. So one is the learner should have, be very prepared that what is the end outcome of particular session. So you go by session. You prepare all the prerequisite for this session, clarify the objectives and outcome. Now this not only helps you in motivating yourself for the class, but also engages or enhances your own self-efficacy, that yes, I can learn in this challenging environment. Second is become coachable. You coach yourself. Now you are the coach. You ask. You design certain assessment plan for what I have learned, and then design certain questions. Third is you proactively approach the teacher whether through WhatsApp platform, LinkedIn, or any other interactive. Nowadays, many institutions have created virtual faculty lounge where students and faculty members can virtually, get in touch, just like, giving a virtual feel of the college or campus. Now you drop in your questions, or you ask, sir, I want 1 or 2 assignments on this particular topic. Now this gives a lot of, and believe me you, that this gives a lot of hope and lot of positive reinforcement to the teachers also, that yes, the students are really interested, they are in the learning mode, and now let me also participate in this. Third is take ownership of learning. Take leverage what can be leveraged by the collaboration and teamwork. Now this is the collaboration effort, because you don't have to only think about your own concern ki sir mera internet kaam nahi kar raha hai, ye hai wo hai. You should also remember that the poor teacher is also struggling with the same technical glitches. So you have to understand the concerns of yourself as well as the other relevant stakeholders, and see how best you can utilize the limited opportunities which you have in this particular stressful circumstances, to get the maximum out of it. Okay, so here are my concluding remarks. Be positive, be informed about the real situation, be cognitively informed. And how can you cognitively informed? Reject all the rubbish which is circulating in the media. Go back to authentic sources. Based on the authentic sources, apply your own knowledge and use those precautions. Not only you use, but you also teach your loved ones, whether it is elderly, your daddy, or your grandfather, grandmother, or small children. Okay, and also communicate or communicate some positive news if you're coming across, so that people are well informed about the positive news, and they are less anxious, they are not developing anxiety, or their anxiety is getting lower down because of your positive efforts. So with this, I would like to end my talk. Thank you so much. If you have any question, you can just pitch in.
Thank you so much, sir, for your valuable information related to COVID-19. We are running short of time, sir. We have 20 minutes for each speaker. So now we are moving ahead. Thank you so much, Rama, sir, for giving your time.
Thank you. Thank you.
Now we are moving ahead to Dr. Sudhir, sir. Sir is now connected with us. We welcome you once again, sir.
Sir, you are on mute, I guess.
Am I audible to all?
Yes, now you're audible. Can you hear me now?
Yes,
Yes, sir.
perfect.
Yes, sir.
Such a good evening. Great pleasure to be with you all. It was a wonderful hearing Dr. Yadav.
Thank you. Thank you, sir.
Yeah.
Thank you, sir. So, sir is connected with us now. Already I briefed about sir.
Okay.
And I'll request sir, Bandari sir.
Should I start?
Yes, yes, sir.
Yeah.
Yes, sir.
First of all, I extend profuse thanks to all of you, especially my very scholarly colleague, Dr. Lokendra Sharma, who's connected me to you people. So my thanks to Dr. Lokendra, and my thanks to all of you for having invited me. Now, before I start talking about the educational impact or psychosocial impact or impact as a whole of COVID-19, we need to understand what is the reason for impact and why this impact came into existence. I give an example that before the COVID was entering into India, even in month of January and February, we heard and read so much about the causes of damage COVID caused, so we were worried. Our fear psychosis as a consultant and doctors was also on the peak in month of first week of March. But over the period of time, you look, 4 months have elapsed. We have learned more about the COVID. We have learned more how to handle COVID. We have saved more and more lives. And hence our fear psychosis, which was very at high pedestal, has come down. So what the reason of all this, what we are talking today, is to have the genuine update and knowledge about COVID-19. So once you have a good knowledge about it, Once you know the facts about it, you will be very confident not to worry and not psychosocially affect yourself. I give an example. Suppose you are in flight. There is some turbulence in flight, and there are two situations. In one situation, pilot says, just don't worry, you land safely, bear with this turbulence, tight your belt, you are at peace. Because the end result, pilot says that we are going to land safely, don't worry. The another situation is that pilot says it is beyond my control. I'm not able to handle it. And probably I don't know what is going to happen. And then the fear psychosis sets in and everyone is stressed out. So on the day one, when the first COVID patient happened, it was a situation like second situation. But over the period of time, unparalleled effect of government, unparalleled effect of all of the involved agencies, especially the medical professionals, the police, etc. The way we have learned about the causes of pandemic and way we have handled it, I can reassure you that we are in a first stage with not to worry. Before I talk about the issues which is arising from this pandemic, I would share some facts so that more than half your worries, your stress, your depression will go away when I share facts with you. The facts are that 80 out of 100 patients who gets infected with COVID have mild symptoms or no symptoms. So it has no consequences and it doesn't bring any significant sickness and it doesn't endanger your life. So look here, 80% are safe. Remaining 20% pose challenge to the society, out of which 15 to 70% might have a disease, might have pneumonia, might have some complications of COVID. But with the understanding of disease, with the new modes of treatment, you must have earlier heard that COVID means lung pneumonia. But now we have discovered that COVID infection not only causes pneumonia, it makes some clots in the lungs, it makes some chemical to release known as cytokine, it causes the hardening of the lung. So we have understood all the causes which can cause mortality or morbidity in patient, and we have learned to treat them, and our results of treatment have been phenomenal. So another 15 to 17% people, though they require assistance, but they are recovering. So 80 mild symptoms or no symptoms, 15 to 17% requiring perfect treatment and they're getting better. Only 2 to 3% people who are elderly, who are our parents and grandparents, who are 60 plus and who have comorbid conditions like diabetes, heart problem, the cancer, the asthma, they are at people at risk. But if these people also, along with all the 97, follow the 3 protocols of masking, the social distancing and hand washing, then probably we can protect them also. So another important thing is that, so you need to be very sure that we have understood the disease well. 80% have no risk, they are mildly or asymptomatic. 15 to 17% who have a moderate disease might require hospitalization, but they also get cured and treated. Only 2 to 3% people, that too also if you report early, take medical help early, you can protect them. So I must reassure you that definitely this pandemic has caused a lot of stress and tension, but we need to be very intelligent. Every cloud has a silver lining. Every difficult situation has a silver lining, so which I'll talk to you later. So as COVID-19 pandemic continues to expand in India and in the world, only one thing is certain, the current outbreak will have profound impact, not impact, not only on our physical issues, but a lot of mental and social things we need to be very careful about it. The economic situation gets affected, but also on the psychosocial well-being of various societies and of the nation at a large also get infected. So you need to be very careful. Most of the nations across the world have implemented complete lockdown with stringent social distancing. You have gone through this phase, which ensures for breaking the chain of transmission of COVID-19. But it has got its own outcomes. The current outbreak of COVID-19 is heavily impacting the global health and the mental health. Make sure. But here I must tell you that once you have a reassurance that your health is going to be protected, well taken care by medical facilities and knowledge available. So your mental health should improve and mental agony should come down. Despite all the resources employed to counteract the spreading of the virus, additional global strategies are needed to handle the related mental health issues, which is very important. This outbreak is leading to additional health problems, such as all of us are facing stress, anxiety, depressive symptoms, insomnia, denial, anger, and fear globally. But I must share with you, having heard my first statement that the percentage of people are going to improve, they are going to recover, I hope all these symptoms should get diluted. To protect people and prevent the spread, it is critical that public mental health paradigm and measures are used carefully. The country remains vulnerable towards COVID-19 given the high population density. You know, we have a very high population density. We are almost 8 times the US population. We are almost 30 times the Italian population. The socio-economic fabric and overstretched healthcare infrastructure are certain very peculiar to our country. The total lockdown was the only immediately available, best and the ideal solution to control COVID-19 pandemic in India. Here, I would like to reiterate, many people are not so comfortable. They are critical. It affected the economy. But I must tell you, the total lockdown was the only immediately available, best and ideal situation to the control COVID-19 pandemic in India. If you are healthy, we can re-establish our economic losses. But if you are unhealthy, no one can do better in later life. The social and economic issues due to COVID-19 pandemic will result in mass unemployment. That might happen because of the lot of industry closure, the business closure, etc. But don't get disheartened. Depleted social network, safety nets can also be affected. It may increase homelessness. It may increase in gender-based violence. It may make people resort to alcoholism, cause hunger, loan defaults, and millions of slipping into poverty. This could be outcome, but public at large has come forward to overcome this stress, which is beyond anyone's control. It is beyond the control of government, administrator, public at large. So we need to all come forward to meet out these social accidents which might happen with the COVID-19. This post-COVID landscape will definitely lead to an increase in mental health, stress, anxiety, depression, alcohol dependence, and self-harm. Recent evidence in psychosocial sciences also show that similar pandemics of symptoms of post-traumatic stress disorder, as well as confusion, feeling of loneliness, boredom, anger during and after quarantine may happen. But I reassure you, we can all tide over by very good counseling, updating the exact knowledge. As my dear previous speaker said, infodemic, which is a very relevant term. Otherwise, I would also use a term known as University of WhatsApp. I must share a very interesting instance with you. Recently, I was traveling from Calcutta to Jaipur. I was surrounded by, on the both the side, two gentlemen. Few in front and back were also their friend. Throughout my journey from Calcutta to Jaipur, they were talking about COVID-19. And as a doctor, I realized how less I know about COVID-19 by my all fellow passengers are loaded with information. So make sure that you make some genuine input from some doctor friends and feel confident from the information I gave you. That will definitely take care of your fear psychosis. A small team of peer counselor work under a local administrator and trained on community mental health issues is very important. It is time to build mental well-being and resilience into schools, the community, and their families. We need a systematic approach to build the demand for mental well-being, which is very important. The Government of India's Rashtriya Kishore Swasthya Kalyan National Adolescent Health Program, you know, there's a Government of India running a national health adolescent program, which can play a very important role because most vulnerable age group is adolescents. They have a half-cooked knowledge, may play a pivotal role in social and behavioral changes and enhance adolescent resilience against the mental health challenges posed by this pandemic. India can end the lockdown now additional revenue available for revival of the economy can be spent on increasing testing. Look here, we were having hardly any facility for testing. Today we are doing lakhs of tests per day. This has been possible because of the great endeavor of our nation, our government, our prime minister, and this will help to reduce the psychosocial issues related to COVID, because more and more testing is done, people turn out to be negative, they become confident. Isolation of facilities, hospital beds, critical care, and comprehensive approach which is available, which make people very confident. Information, education, and communication, IEC, on the social distancing and mental health, addressing the mental health issue of vulnerable population during this lockdown is very important. The country can gain much more through continuation of bans on mass gathering, which is very important, school closure, restriction of movement of the elderly population and children below age of 5, covering the mouths and noses in public, still should continue to lead a healthy life. We need to learn to live healthy and happy for at least 1 year more. Don't be dependent, don't be lax in your approach that vaccine is coming. Even if the vaccine comes at the end of this year, it will take few months for immunity to develop after you get vaccinated. You need to be very careful about spitting habits, physical distancing to the extent possible in the public places, and expanded testing. All are going to reduce your physical and mental stress. Mental health support follow-up should be provided even 6 months after the release from isolation for those individuals. Why I'm telling you, a person who has been admitted, person has been put on quarantine, even should be followed for next 4 to 6 months. How's he doing to relieve him of the stress? And he need to be very careful about it. In the current context of lockdown, which is now almost over, and restriction of movement, children have constrained access to socialization. I'm more worried about psychosocial and issues in the children. Children play not possible. Their access to socialization is not possible. Even physical contact, critical for their psychosocial well-being and development, is missing. School closure are preventing children from access to learning and limiting their interaction with the peers. Children may feel confused and at loss with the current situation, leading to the frustration and anxiety, which will only increase with their overexposure to mass and social media, especially among adolescents. That's why I would be very keen to tell all of you that all the children at home, make them understand that what is the truth, give him a brighter side of situation, give him a statistical that if we take care, you will not suffer. It is a time to sit with your children, spend more time while talking, more time having breakfast, lunch and dinner together, more time watching movies together, more time sitting and gossiping together, more time helping them to study together. Probably, as I told to you in beginning, every cloud has a silver lining. This difficult situation has given a more chance to be with family, with our children, with the elderly people. There's a more strong possibility of grandparents interacting with grandchildren. So we need to take care of these issues which might arise because of this COVID-19 in children. Some adults may struggle to find ways to explain and communicate with the children about the current situation in a way that it is understandable by this age group, which will add frustration and disattitude in children and adolescents. We need to be very careful about it. COVID-19 is also bringing new stressor on the parent and caregiver. It is not only stressful for sufferer, but for the parents and caregiver. This can hamper their capacity to provide care and remain engaged with their children. Being very keen observer of people and environment. Always remember, children are very keen observer of people and environments. Children will notice, absorb, and react to the stress in their caregivers and community members, which unavoidably will affect their well-being. So always remember, you need to be de-stressed, parents need to be de-stressed, community has to be de-stressed, because children who observe them, and they will go into the psychological trauma. And the above is the only beginning. Level of stress will exponentially higher among vulnerable families. You need to be careful about it. For children who are deprived of parental care in child care, in situation or in alternative care, children living in the streets or children migrant and on move. For example, the situation will practically challenging for all the children or the different state of the society. Prior experiences in the public health emergencies have demonstrated that there is a high likelihood of an increase of violence, including gender-based violence, domestic violence, or corporal punishment against children and women. With the current movement restriction, girls and boys victims of violence will face obstacle to seek out for help and have access to support system. So I would be very particular to tell all my friends here that make sure give a very positive information to children, spend more time with them, spend time in teaching them and educating them, reassure them that all are going to be healthy, we are going to tide over crisis. And the another silver lining is that all of us learn discipline. Cross section of society has learned discipline about the social distancing, queuing at the shops and grocery shops, spending very carefully, not to spend or not to waste the money, to spend, and children will learn how to take care of parents and grandparents. Childhood is a critical period in any human's life, which marks the foundation of the person's personality and emotional resilience capacity of any person. In these difficult times, let us all commit to mitigate the effect of COVID-19 on those who deserve the most protection, the children. So I would conclude my talk with a suggestion that for your knowledge, most of the people are asymptomatic, 80% to not to worry. 15 to 17%, they have medical issues, they are very treatable. 2 to 3%, we need to be very careful. And to overcome the stress, we need to report to doctor early and to protect them by 3 standard protocols of masking, the social distancing and hand washing. And above all, rest assured that as the period passes, we become more used to handle the COVID. We only need to be very careful about it so that our social and psychological stresses are not there. Regarding education, probably in a defined way, because the congregation, classrooms, and the big halls and prayers and meetings and lectures have to be avoided because they are very contagious situations. Hence, you need to have the best out of your online and in-house readings, and you need to be careful about it. Lastly, I would like to just bring to the notice of a student that many people ask, why mask? Why mask? I must share with all my student colleagues that suppose I'm COVID positive, if I'm talking, I'm throwing 20 to 40 viruses per minute in the atmosphere. If I cough or sneeze, I'm showing 20 million, 2 crore viruses in the atmosphere. And you require only 1,000 viruses. You require only 1,000 viruses to inhale to get the disease. And that's the reason, dear friends, that have the mask so that accidentally if you have a infection harboring as asymptomatic COVID, you don't infect others. Secondly, why mask is important? Suppose someone is coughing who might carry the viruses, so you don't let the viruses enter in your mouth. Why distancing? Because when someone coughs or speaks, the viruses goes up to 3 feet, then they fall down. So if you keep a longer distance, you don't expose yourself. And why hand washing? Because these viruses, when they fall on solid surfaces, like they've fallen on the table of your college or library or on the restaurant or the railings, we touch our hands. This virus remains alive on the hands if you not wash for 24 to 48 hours. So you may touch your mouth and nose, etc. So dear friends, dear colleagues, dear children, I reassure you, having known the statistics of disease, rest assured, definitely we have a pandemic, but we doctors, the medical fraternity is there to make you feel better. So don't get a psychological depression set in, number one. Number two, you need to follow these protocols. You need to be mentally prepared few months and years so that we don't have increase in the disease pattern. Thirdly, always be hopeful that this is not end of everything. It has made you more disciplined, have more family oriented person, spend more time with your children, and try to find out what is the best of a given situation that you must have never taken all the 3 meals with your parents and grandparents, that is the best way to elevate the stress and tension. Now, regarding education, I would like to share with you that education is a level of self-knowledge. You definitely like teachers, you definitely like the people to mentor you, to guide you, but you can continue to acquire the self-knowledge by your self-reading, online reading, connecting to all your mentors online, and continue to do. In fact, I must share with you, in our medical college, physically, when we used to have classes, there used to be attendance never more than 50%. Dr. Lokendra will agree with me. When we started taking online classes, 95 to 100% people gets connected. There's a better interaction, more questions, and more abilities of the students we come to know about it. So definitely, in a given circumstances, we need to improve little educational pattern, but I'm only concerned more about children, because in children, especially those who are from age group of 5 to 15, they are so raw. They are like a plain paper. So they need to observe more happiness. They need to observe more confidence in learning the COVID. They need to observe the gloomy society. They need not to see the gloomy society and gloomy people, all right. They need to be taught about all these social protective measures, that is SMS, that is social distancing, mask and sanitization. And they are the one, they could be our role model to de-stress society, de-stress colleagues, give a positive feeling to all the colleagues and all the people around. That's all what I would like to say as a doctor. And I'm really thankful to all of you to having invited me. And it's a wonderful endeavor and wonderful, I think, endeavor of yours to absolutely disseminate among knowledge among your colleagues in institute.
Thank you. Thank you so much, sir. Thank you so much for your valuable talk. Am I audible to all?
Yeah.
Yes, audible.
Yes, audible. So we have an announcement after this. Once we over with this features, we going to have a panel discussion from 8 o'clock to 8:55 p.m. So please stay connected with us. So moving ahead, now I would like to call our next resource person. Before I will call sir, I would like to give a very brief introduction about sir. Dr. Vimal Kumar Sharma sir is a vice chairman of Global Rural Mental Health section of World Psychiatric Association. He served as a medical director and a director of research for CWP NHS Trust. He also served as a deputy leader for Northwest MHRN Hub and Royal College of Psychiatrist Examiner. So we are very privileged to have you, sir, for this evening. So, Vimal sir, over to
Okay.
Vimal sir.
Yeah, thank you. Can you all hear me?
Yes, sir.
Okay.
Yes.
Well, thank you, and thank you for organizing this
sir.
meeting. I see familiar faces. Dr. Sudhir Bhandari has given us a wonderful talk, and we work closely with SMS. And I think just to disclose some secret, that 4 of us are from SMS Medical College. Professor Bhandari, principal. Dr. Anil Sharma, he's in the United States. Dr. Lokendra, who organizes these educational programs and takes a lead on education in SMS College. And we work very closely with SMS College and in Rajasthan for mental health, and in other states in India as well, besides other countries. I'm based in the UK. I'm speaking from the UK. So thank you for allowing me to share some of my thoughts with you. Dr. Bhandari has already outlined, and I'm delighted that even being a physician, he was able to address mental health issues in such a lucid and clear ways. And therefore, he hasn't really left much for me to say. And we have other eminent people like Dr. Anil Sharma, who will probably highlight some of the specific issues. But I thought I'll just briefly outline, based on evidence so far globally, how does epidemics impact on mental health and well-being. And the first thing is social isolation due to lockdown. Now, it's important to understand it causes obviously negative emotions, but what are the factors which lead to these negative emotions or adverse impact on mental health? And obviously, it is related to stress. And the stressors are longer duration of social isolation, fear of infection, then frustration and boredom due to not able to do things which people normally do. For instance, traveling, seeing friends, having parties, going to weddings, going to cinema, etc. Sometimes pandemics may lead to inadequate supply of stuff you want to get, information or lack of information or misinformation is a big issue. And I think as COVID-19 progressing, we are learning new and new things every day. Financial loss and stigma attached to infection. Now, I think learned people who are here, I don't think they're worried about it, and people elite probably not worried about COVID-19. But look at the community. I think if you go in the community, people still have fear and they try to hide their problems. And if they have some symptoms, they worry that what will happen if we disclose to specialists. So all these things lead to stress and lead to adverse effect on mental health and mental well-being. Now, the second important issue is that due to this ongoing or significant stress, it may lead to mental health problems, or it may worsen the mental health problems, those already suffer from it, or it may precipitate mental health problems who are vulnerable to or prone to developmental illness. And obviously, these excessive stress may lead to depression, anxiety, substance misuse, post-traumatic stress disorder, suicide. And I think another important thing is quite complex grief reaction, because in many situations, people were unable to see their dear relatives when they died. They weren't able to do their last rites in a proper fashion. And sometimes they had to live with that kind of guilt for a long time. The people who are hospitalized and suffered from COVID symptoms, and especially in earlier phases where there weren't sufficient or enough treatment to overcome those symptoms, they are more prone to developmental health problems. And I think one of the things is for those who were affected quite badly by COVID, we don't really know what will be the long-term consequences, both in terms of physical state as well as impact on their mental health. The other important thing is the relationship between economic downturn and mental health problems. That is very well established, whether it has been due to any kind of pandemic or even due to economic recession due to other reasons. For instance, in around 2008, we had severe economic downturn. And especially in the Western world during that time, there was an increased rate of child abuse, domestic violence, substance misuse, suicide, and mental disorders in general. And I think there is a risk that the consequences of COVID pandemic may lead to economic depression in almost all countries, and that may lead to adverse consequences of mental well-being and health. It's important to recognize that specific populations like elderly population, which are more prone to develop anxiety, depression, frustration due to social isolation. Obviously, they have increased fear of having adverse effect of COVID. Children and younger people, as Dr. Bhandari already highlighted, that longer term staying away from school has adverse impact, boredom, and it may lead to conflict in children. And I think I wouldn't really go in more detail, but that remains a vulnerable group of people, and one has to keep them in mind. The frontline health workers and frontline workers in general, they facing quite difficult situations, obviously add to their stress. And sometimes these significant events stay in their mind, worrying them and having a sort of longer term consequences. My son is working as a registrar in emergency medicine in Melbourne right now. And he was telling us that sometimes they had to made quite difficult decisions when people in severe state came at the front end. And obviously he was quite distressed and disturbed as a result. And I think many frontline health workers face the challenging issues. Even in India, in some of the cities, there are lack of beds, for instance, where there is certain rise of corona cases. If I talk briefly about people with mental illnesses, that mental health services always been inadequate to provide fully fledged services to all. There has always been a treatment gap highlighted by WHO, but with this additional stress and resources diverted to physical health and other areas, I think people with mental health problems are even, there is a risk of them getting left out. And I think because of lack of availability of services at present, there is a risk that people may be left suffering for a little while, and that may make them at a sort of severe state before they get attention from services. I think I would very briefly outline that what we have to focus on, in other words, what should be the recommendations or solutions of these problems. Obviously, you need funding to provide adequate resources and money in order to provide services to people who are adversely affected through pandemic. But importantly, you have to provide access to services. And I think in that way, one of the things here in the UK, we learned during COVID pandemic that the family doctors, they didn't need to see people face to face to avoid catching infections or passing infections. And most of the consultations were done through either telephone or video conferencing. And that became so successful that the health minister now recommends that this practice must continue. And I think using technology, we can access to many people in providing services. We have to focus on supporting frontline health workers and also vulnerable groups like elderly and children. The important thing is training in mental health. And as Dr. Sudhir Bhandari pointed out, and I was quite impressed with his due importance given to mental health by him, is that training of mental health, in my view, must be provided to all health professionals, a basic training. And this is an area where we have been working for a number of years, and I'm sure Dr. Lokend will highlight that in his presentation. So I'm not really touching that. Prevention and public health education is important. And all talks about how to manage stress, how to make life more worthwhile, how to live happily. We have talked about this, and I think I'm not really going into any detail of that, but I think that's important. But equally important is making public aware of mental well-being of population, how pandemic affects mental well-being, and what are the ways they could be helped to prevent. But if they suffer from any consequences of mental health problems, then what should be the earliest possible solution to them? I think the important thing is it should be an integrated public health strategy from central government to a local level, where mental health becomes an integral part of overall health services. And I think with IT people, I'm quite delighted that Institute of Technology is giving due importance to mental health and well-being. And I think I will stop that unless there are any questions, because I'm aware of the time. And we have other experts who will probably share their expertise in their presentation. Thank you.
Thank you so much, sir, for your illuminative lecture sharing with us. So we have a panel discussion around 8 o'clock, 8 to 55 p.m.
Sure.
And so in that time, we will going to take a question answer round.
Okay.
So moving ahead, today we have our next resource person. I would like to read a very brief introduction about sir. We have Dr. Anil Sharma sir, who is a board certified psychiatrist and clinical pharmacologist, expert in psychotic disorders, addiction and substance abuse. Dr. Sharma sir holds various medical director and chairman positions at inpatient psychiatric hospitals and substance abuse programs. With more than 25 years of medical experience, Dr. Sharma sir serves as one of founding partners of Escalate Research Centers located in Panorama City, California. He is committed to advancing the care and treatment within the medical health arena. Sir, over to sir.
Thanks for a nice introduction. And it was great talk by Dr. Vimal Sharma and Dr. Sudhir Bhandari, and I'm very fortunate to be on the same platform as our professors to talk about what's going on. So as you know, COVID-19 is not normal times. These times are very special, very special pandemic in a way, very scary, but things can get better if we all take precautions, as Dr. Bhandari and Dr. Bimal Sharma stated, like importance of mask, distancing, following up with your doctors. I personally, I know people, my friends who were first line providers got infected, and even some people we have lost in this fight. And it has been very difficult for providers themselves, because we have to take care of our patients and we have to take care of ourselves too. And it's affecting us in different aspects, physical, financial, psychological. All these fronts are getting affected. I came across a very good study from a Chinese university about SARS. The study indicates that even when COVID situation will be under control, or COVID one day will disappear or go away, unfortunately, mental health issues would last much longer than that. So that study talks about SARS. If you remember, SARS epidemic happened in about 2003. And after SARS was under control, Chinese university did a major research project, and they found about 40% population of Hong Kong were affected by mental health sequelae of SARS. Most common was anxiety and PTSD, or post-traumatic stress disorder. COVID is on a much larger scale than SARS. SARS was very focused in some Asian countries, but COVID-19 is a true pandemic. Every country, people from every walks of life are affected or infected by COVID-19. So of course, we will have problems way longer than the physical aspect of COVID will last. What kind of problems? As you know, most common reactions are stress, increased anxiety, depression, and PTSD. As Dr. Vimal Sharma report stated, there's already stigma to mental illness, and now in this time when it's very difficult to access healthcare, this stigma is even tenfold. People who are getting affected by COVID-19, or their family members are getting affected, they are in that phase. Either they are experiencing guilt that they cannot be there for their family members. They are under a lot of fear that they themselves may get infected or may transmit this infection to their family members, their elderly family members, or their children. Schools are shut down, but eventually schools will open, and we will have another wave of fear or stress or anxiety. Financial anxieties are there, and I know that governments are helping businesses and other people to go through this process, but as individuals, we have to be prepared for these difficult times. And how do we do this? In mental illness, there's a big role of group therapies, individual psychotherapy, being there for your patients. And in this time, even that's not possible. So we are utilizing a lot of telemedicine or telehealth. We are seeing patients, even I'm rounding on inpatient unit using telehealth. Some patients, we are seeing them on telemedicine. And in psychiatry, or even in other fields of medicine, the connection with patient is more important. Even if it's through the technology, you can still make the same kind of connection and make an impact on their mental illness and their treatment. People who already have mental illness, they have other problems like getting their medication refills, getting their psychiatrists or therapists see them on a regular basis. People who have no mental illness, first of all, they have to realize, because in any mental illness, there's a stage of denial. Initially, we said, well, it cannot happen to us, but it can. So seek help. Unfortunately, this time, not a lot of psychosocial support is available in terms of physical support, being there for others. Humans are social animals. We like gatherings, we like people around us, but in this day and age, social distancing is so important that we cannot even see our near and dears. So we are using technology a lot. As you know, treatment of anxiety and PTSD, group therapy, cognitive behavioral therapy play a major role, even more than medications. So we have set up some support groups, which are virtual online support group, trying to create awareness and trying to join people so that people can learn from others' experiences. How are they coping with it? So in one of the initiative is called wellnesshelpline.com, where we are trying to build larger support groups across the globe, in United States and India. In India, we only opened up for frontline providers like physician, nursing staffs, and ambulance person, but we are planning to open it to general public so more people can join these virtual support groups and able to help each other by our experiences. Children are getting affected, and that's a completely different situation because kids at different ages, they have different ways of learning or different ways of processing. If you have very little kids, little children, they do not understand what's going on. They know that they are not going to their daycares or preschool. So you can sit down with them and explain in basic terms that there's an infection going on. We are trying to avoid all the physical contacts because this virus jumps from one person to another, or it can be transmitted by touching the same surfaces if an infected person has touched those surfaces. Problem is, kids who are older in terms of teenagers, anywhere from 14, 15, 16 years of age, because in their lifestyle, social interaction was so important, playing sports, going to schools, going out with friends, and they have difficult time understanding why they cannot lead a normal life at this time. As kids, they always think that they're immune to everything. So our goal is to provide some education to them in age appropriate manner so that they can understand what's going on and how they can prevent themselves and others. Okay. Substance abuse and domestic abuse are another major problem which happen during any pandemic. People are at home, they are working from home, and rate of tobacco consumption, alcohol consumption, and other drug consumptions are going high, which are creating other problems. Domestic abuse, because people are in the four walls more often, more spousal abuse, more child abuse cases are coming forward. Also, people who have chronic medical conditions like diabetes, heart conditions, just remember that heart attacks and strokes don't go away in pandemic. You still have to take care of yourselves. Make sure that you have enough medications at home. Make sure you are still controlling your diet and exercise. And speaking of exercise, I do tell most of my patients it's one of the great coping mechanism. People who are stressed out or high level of anxiety or depression, other than counseling, getting support from family members, exercising and a balanced diet is very important. In some people, all these methods may not be enough, and they may need medical or psychiatric care in terms of medications. So just remember that there's help available. Each community has these doctors or psychiatrists who are still available by phone or by telehealth. So please make sure that you reach out to them. We are still seeing a lot of patients, and I see patients who are either affected by COVID or their family members are affected by COVID. And we are trying to provide them more psychosocial support system in terms of education, because there's so much misinformation out there, as Dr. Bhandari mentioned, and Dr. Yadav said, there's an infodemic. I like that term. There's so much misinformation. All of a sudden, everyone is an expert in COVID and pandemics. So try to get your information from the right source, from the valid sources like CDC, WHO, ICMR. Each community has, valid sources of information rather than getting all your information from social media, which is difficult in children or adolescent of teenage years, because they are very well connected to social media, and that's where they get the information. But as a parent, you need to sit down with them and explain that what all information you are seeing in media may not be true. So go to the valid source of information to obtain your information. Also, there's flooding of information. You open the newspaper, you go on any news website, most of the news are pertaining to COVID, which of course is important because, that's a pandemic, had affected more than 4 million people in the United States and all other countries. It's a good number of people who are affected either directly or indirectly. Indirectly, it's affecting pretty much all of us, in terms of financial difficulties, in terms of, our family members, our friends getting infected, and this fear of getting infection is huge. So it is affecting us. And the thing is, how do we prevent? What can we do in this time? As I said, reach out to get valid information, reach out to your family members or friends for support. You may get information which may not be true, but if you sit down with your family members, you can get the right information, or go to the valid sources like CDC, ICMR, etc. Please support us in our initiative of making this virtual support groups at wellnesshelpline.com, which we'll soon open to general public in India, so people can support each other. In PTSD, normalization is one of the process in recovery. We learn from others who have already processed and learned some coping skills, and we can learn from them, from how they are coping with the illness, and the whole community can be benefited. With this, I think my time is over, so I will hand it back to our moderator, and will be available for question answer session.
Thank you, sir, for an enlightening presentation. So in this process, now I would like to call Dr. Loken Sharma, sir. We have our next speaker. Before calling sir, I would like to give a very brief introduction about sir. Dr. Loken Sharma has published 50 national and international research articles, and he has presented his research work in international conferences in Australia, USA, Vietnam, and Japan. He is working in international collaboration with Manchester University, UK on numerous projects. He has received prestigious WHO fellowship. So over to sir. Loken Sharma, sir.
Thank you, Dr. Lakshman, for inviting
Welcome,
me just I want to share my PPT. Basically, we are involved with global mental health assessment tool for so many years, and I hope this in crucial time, this tool is basically helpful. Uh, we are also try to think that this global mental health assessment tool training for medical students and all other students, it can be beneficial for present situation, which is I think very difficult situation as far as this COVID adverse disease reaction can a term we can use this post-COVID scenario. We are also have jointly working with number of mental health project with Manchester University, where the Dr. Vimal Sharma has already told us so many current issues related to COVID, and we also have uh, working with Dr. Anil Sharma, and we are trying to develop some wellness website with Dr. Anil. He is working in UCLA. And India, we are different consultant of our SMS alumni in Rajasthan also. We are also supporting development of wellness website, which is very helpful in present situation. And I want to tell you about this global mental health assessment tool, which is basically mental health assessment that is computer assisted, clinical interview based, and use it is in clinical practice by day-to-day by health practitioners or healthcare workers. And from so many years, we are also training. Uh, we are also training medical students from last so many years with consultant of psychiatry, Dr. ID Gupta sir, and department head and students. They are also supporting us for training of medical students. Basically, in this tool, this is rating system or score system is there. If patients have some any illness of stress, anxiety, which is COVID phobia, any type of symptom is suppose there is rating system is there, 0, no symptom, 1 system, then and 2, 1, 2, 3, and 8 and 9. This is other rating system of COVID. Then this is basically we can download this tool from www.gmhat.org, and this is free of cost. This is developed by Dr. Vimal Sharma. This is basically assessment of adverse reaction of stress level by yourself, and this we can use for this teleconsultation tool for support also. And Dr. Vimal and his secretary consultants, they are using this tool from homeless persons, mentally health, well-being of these. And this is amplify positive and hopeful story. If suppose anyone learn this tool, and it is definitely help in improve their positive thought and well-being. And we have to involve educate students for some try to learn and try to involve some positive story and positive news from media. From this, as far as this tool is concerned, we have this initially that when open this tool, there is instruction in this tool is there. After that, we have to have consent form, which can take consent of patient or healthcare worker. Then these are the questions, different questions of all different anxiety, multiple questions. On the basis of that question, anyone healthcare worker or anyone can go through particular disease and try to understand disease. And even if suppose anyone is involved in learning GMAT tool and using global mental health assessment tool, is able to identify a disease. If suppose any person is identified disease of his herself or their relatives or their friends, this is very helpful as far as this mental health program is concerned. We are also working this global mental health assessment tool from last so many years, from 16 batch, 17, 18 batch. Then we also try to involve this tool for in traditional teaching also, for integrated teaching also, and we also use this tool for different postgraduate students and in different like cancer patients, tuberculosis, and asthmatic respiratory disease patients. This tool is very helpful as far as the stress of different disease is concerned. We also taking few studies in COVID period also. We also using taking help of Telegram and WhatsApp in for GMF training. This is as student you know very well that is Telegram is cloud based system. So we take a group, make a group in Telegram and WhatsApp, and this is Telegram is available in the all applications and what mobile application also. So this is a message exchange, and we are make a group just educate and training students in different groups. So we also recently conducted some studies in COVID patients. They try to assess the level of depression and mental illness in COVID patients, their relatives, healthcare workers. All these we have number of studies. We are our students and our department of pharmacology conducting in a state, national level also for stress of online stress during lockdown, post-lockdown period, and in students of stress of examination, with lots of issue of examination also. With Dr. Vimal and Dr. Anil, we try to develop COVID social support system also globally, involve several doctors from different countries just to provide support to all these healthcare workers, their relatives, and patients also. And we also try to develop paperless activities for hydroxychloroquine pharmacovigilance during COVID period. The purpose is just to remove stress amongst healthcare workers involved in management of COVID patients and their families. We also have some certain online activities like continuously doing webinars for different college in engineering college in Rajasthan, medical college, and we using the social media and media newspapers for supporting and for increase awareness and involvement of patients and healthcare worker for psychosocial support systems. We also try to use Facebook and other social medias for support of psychosocial support and awareness, positive awareness of COVID, and just to remove COVID phobia in general population and healthcare workers. So we also using some good platform for this conducting regular webinars of our institute and in Rajasthan also. So we have developed one book and chapters in this global mental health assessment tool with the help of Dr. Vimal, I.D. Gupta sir, and Dr. Kusum Gaur. We have tried to involve our teaching by using integrated teaching in our student training programs, training themselves, improve their clinical exposures. You have a good publications of how we can use acupressure points to reduce stress. The certain points which can be used. We have conducting this type of study also is also helpful just to remove stress amongst students, patients. These are the certain acupressure points which are available in our website also. We can use these points just to remove a cope of stress, post-COVID stress, and stress due to COVID periods. These are some pictures which we at our college conducting jointly webinar with our Rajasthan Medical College Teachers Association and with other college and IIT regarding this. We have tried to create awareness uh, amongst uh, patients, students, just to remove COVID phobia. And thank you very much. We also involved in healthcare of Rajasthan. We have developed healthcare for COVID patients, non-COVID patients, and we are also conducting pharmacovigilance activities for COVID and non-COVID patients, their treatment and prophylaxis treatment and management all over India. All pharmaceutical departments they are involved in care of this. Thank you very much, and thank you organizers giving me opportunity to uh, give my presentations and our work with Manchester University and with jointly with Dr. Vimal Sharma and Dr. Anil Sharma. They are jointly supporting us during COVID period. We are regularly in touch with them. They are also supporting Apna Ghar type of centers in all over India and Rajasthan, providing healthcare facilities to
Pandemic conditions के बाद.
homeless persons. Thank you, sorry. Thank you very much, Dr. Lakshman. Thank you very much.
Thank you, sir. Thank you so much, sir. So, thank you for a valuable talk, sir. Now we will move for a panel discussion. But before a panel discussion, I'll ask Rachel to come in, please. Rachel. Audience can also ask their questions. If they have any questions, they can ask us. We are live on Facebook. We are also on Zoom. Neeraj.
Yes, sir. I think Rachel can take over.
Rachel is there?
Yes, sir. Yes, sir.
So before panel discussion, I have to say a few lines. Just let me get in. Neeraj, are you there?
Yes, sir.
Please convey the message to Rachel.
Yes, sir. I would request Dr. Lakshman Yadav to share some of his thoughts. Dr. Lakshman Yadav has pursued his he has completed his master's in Institute of Medical Sciences, Banaras Hindu University. He is the on-campus counseling psychologist in the Indian Institute of Technology, Banaras Hindu University. I request Dr. Lakshman to please take over and share his thoughts.
Okay, I'll take very few minutes and I'll share my experience with you all. बहुत थोड़े में मैं आपको समझाने की कोशिश करूंगा कि जो भी आज पैंडेमिक कंडीशन चल रहा है उसमें बेसिकली किस तरह से इश्यूज आ रहे हैं, कैसे हम उसको ओवरकम कर सकते हैं. एंड वी हैव मेनी मोर क्वेश्चंस आल्सो रिलेटेड टू स्ट्रेस, एंजाइटी, फोबिया, डिप्रेशन और एक साइकोकॉन्ड्रियासिस. जो लोग जो भी पढ़ रहे हैं कोविड-19 से रिलेटेड, वो नेट के थ्रू या मोबाइल है सबके हाथ में, वो स्टडिंग अबाउट द कोविड-19. जो चीज़ पता नहीं है उसके बारे में लगातार वो सोचते रहते हैं और जितना बुरा हो सकता है उतना बुरा से बुरा वो सोचते हैं. तो होता क्या है कि हमारा माइंड कई बार वो सारे ओपिनियंस को क्रिएट करने लगता है. I want to share my PPT with you all. Okay, just okay. Can you share my screen, Neeraj? Hello? 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 Am I audible to all?
Yes, we can hear you.
Sir.
Yes.
Thank you so much, Neeraj. My name is Lakshman, already said, and I'm a counseling psychologist in IIT BHU. तो आपको आज मैं एक छोटा सा टेक्निक देने जा रहा हूँ फैक्ट एंड ओपिनियन का. बेसिकली किस तरह से जो आपके ओपिनियंस होते हैं वो फैक्टिसिटी से जब दूर जाते हैं तो क्या क्या प्रॉब्लम्स आती है. आई जस्ट शेयरिंग माई स्क्रीन. ओके. एग्जैक्टली. कोविड-19 बेसिकली जो देता है फोबिया और एंजाइटी. जो चीज़ हमें नहीं पता है, हम लगातार जब उसको सोचते हैं तो दिमाग उसी में जाकर के सोचने लगता है और उससे वो क्लब होने लगता है, उससे कोलैबोरेट होने लगता है. तो जब हम कोई थॉट क्रिएट करते हैं तो थॉट के साथ हमारे जो ब्रेन की एक्टिविटी रहती है वो कनेक्टेड रहती है और वो कैसे मेमोरी में डिस्टर्ब करती है चीज़ों को. आई टेल यू. जो भी हम एक्सपीरियंस करते हैं अपने 5 सेंसेस के थ्रू वो मेमोरी में जाता है. अगर जो किसी चीज़ को हम सोचते हैं या उसके बारे में जब हम बात करते हैं तो एज इट इज़ उसको हम दिमाग में लेकर के जाते हैं, मेमोरी में लेकर के जाते हैं, ये 5 सेंसेस के थ्रू. अगर जो थॉट नेगेटिव है, सारे एक्सपीरियंस के थ्रू हम चीज़ों को एक्सप्लोर करते हैं अपने मेमोरी के अंदर. अगर जो ये चीज़ नेगेटिव है तो हमारे थॉट भी नेगेटिव आते हैं. अगर जो हमारे थॉट नेगेटिव आते हैं तो हमारे इमोशंस भी नेगेटिव हो जाते हैं. जब इमोशंस नेगेटिव होते हैं तो हम रिएक्ट करते हैं और जब हम रिएक्ट करते हैं तो 3 चीज़ें होती हैं. या तो हम सिचुएशन को अवॉइड करते हैं, या तो वहाँ से हम भागते हैं, या हम स्केप करते हैं, अवॉइड करते हैं, या हम रिएक्ट करते हैं. तो एक छोटा सा एग्जांपल मैं दूँ. अगर जो मेरी किसी से लड़ाई हो गई है कॉलेज में या कैंपस में और एक पार्टी में हम दोनों लोग गए और मैं उस पर्सन को देखा तो उसके साथ जो मेरा एक्सपीरियंस है वो नेगेटिव है. क्योंकि जब आप किसी थॉट को सोचते हैं तो आप उसको वेरीफाई नहीं करते, आप सीधे उसको प्रोसेस करते हैं दिमाग में और उस वैसे ही वो जो थॉट आप दिमाग में लेके गए हैं नेगेटिव प्रोसेस किए हैं बिना वेरीफाई किए तो उसके सारे थॉट्स नेगेटिव आने लगते हैं एक्सपीरियंस बेस्ड. अगर जो थॉट नेगेटिव आता है तो आपके इमोशंस नेगेटिव होते हैं और जब इमोशंस नेगेटिव होता है तो आप रिएक्ट करते हैं. इससे क्या होता है कि एक होता है प्रेजेंट, एक होता है पास्ट और एक होता है फ्यूचर. आपका प्रेजेंट खत्म हो जाता है, आप पास्ट के बेसिस पे हमेशा फ्यूचर को सोचते रहते हैं और यहीं पर आपको मेंटल हेल्थ इश्यूज आना शुरू हो जाता है. तो करना क्या है बेसिकली, हम इससे कैसे ओवरकम कर सकते हैं चीज़ों को. जैसे होता है ना कि आप एक ऑफिस में हैं, काम कर रहे हैं 10 साल से, कोई इशू नहीं है, अचानक से आपका दोस्त आता है और बताता है कि यार यहाँ पे भूत है. अब आप बचपन से भूत के बारे में नेगेटिवली सुनते आए हैं और जैसे उसने बताया उस दिन से आपका दिमाग सारा फोकस वहीं करने लगेगा और एट ए टाइम दिमाग एक ही चीज़ पे फोकस कर सकता है. अभी आप कमरे में बैठे हैं, जब एक कॉर्नर को देखेंगे तो आपको दूसरा कॉर्नर नहीं दिखाई देगा, जब दूसरा कॉर्नर देखेंगे तो आपको पहला कॉर्नर नहीं दिखाई. तो दिमाग सारा भूत को लेकर के सोचने लगता है और होता है ना कि जब आप नेगेटिव सोचते हैं तो वैसे वैसे वो वेरिफिकेशन देना शुरू कर देता है. तो एक होता है फैक्ट और एक होता है ओपिनियन. फैक्ट जिसका एविडेंस है, ओपिनियन जिसका कोई दिन भर में हमारे 60 से 70 हज़ार ख्याल आते हैं हमारे दिमाग में और वो कुछ भी आता है, जिस तरह का एक्सपीरियंस रहता है, जिस तरह सिचुएशन चल रहा होता है उसी तरह के थॉट्स आते हैं जैसे कोविड-19 में आ रहा है, राइट. तो हम क्या करते हैं, जैसे कोई क्लाइंट आता है तो हम उससे पूछते हैं कि जैसे फैक्ट और ओपिनियन क्या है. ओपिनियन क्या है जिसका कोई एविडेंस नहीं है. जैसे मैं बताया 70 to 80,000 थॉट्स हमारे माइंड में आते हैं और ये बिल्कुल कोई इसका लेना देना नहीं रहता, रियलिटी से इसका कोई कांटेक्ट नहीं रहता है. तो करना क्या है कि एक होता है फैक्ट, एक होता है ओपिनियन. तो अब जैसे पूछते हैं कि सूरज कहाँ से निकलता है, एग्जाम्पल के तौर पे अगर जो 1 लाख लोग बोले कि कल पश्चिम से निकलेगा, ये क्या है, ओपिनियन. अभी किसी से लोग बोल रहे थे कि 21 जून को दुनिया खत्म हो जाएगी, इट वॉज जस्ट एन ओपिनियन. उसके बाद कोई ये कहे कि 1 महीने बाद दुनिया में पानी खत्म हो जाएगा, जस्ट एन ओपिनियन. अभी जब हम उससे पूछते हैं कि जो तुम सोच रहे हो अभी इस चीज़ को लेकर के, ये क्या है, ओपिनियन. क्योंकि जब लगातार आप नेगेटिव सोचते रहते हैं तो आपके दिमाग में न्यूरो पाथवेज नेगेटिवली डेवलप हो जाता है. जब वो नेगेटिवली डेवलप हो जाता है तो आपकी जो हैबिट्स होती हैं वो नेगेटिव होते चली जाती है. तो एक चीज़ आप लिख सकते हैं कि माई थॉट्स आर जस्ट एन ओपिनियन, इट्स नॉट अ फैक्ट बिकॉज इट डजंट हैव एनी एविडेंस. जब भी आप कोविड से रिलेटेड आपके दिमाग में थॉट आता है तो आप खुद से पूछिए कि ये फैक्ट है कि ओपिनियन है, क्या एविडेंस है कि ऐसा हो जाएगा. you always collect the evidences कि कौन से ऐसे एविडेंस है जिसके बेस पे मैं कह सकता हूँ कि ये फैक्ट है या मुझे ऐसा कोविड हो गया है। लोग लगातार पढ़ रहे हैं कंप्यूटर पे, मोबाइल पे, न्यूज़ सुन रहे हैं, और न्यूज़ का क्या है, वो मिर्च मसाला लगा के आपको देते हैं, आप वैसे सुनते हैं, उसको एक बार वेरीफाई भी नहीं करते हैं। तो जस्ट वेरीफाई योर थॉट्स, एक बार देखिए कि ये फैक्ट है कि ओपिनियन है। अगर जो ओपिनियन है तो लेट इट गो, इफ इट्स अ फैक्ट देन वेरीफाई इट्स एविडेंसेस। तो ये फैक्ट ओपिनियन टेक्निक अपना करके आप काफ़ी हद तक आप अपना एंजाइटी को रिड्यूस कर सकते हैं। So next we are moving ahead for panel discussion. Hello.
Yeah.
Am I audible to all?
Yes.
Yes.
Yes, sir, you are.
So now I will reach to them with my questions to my panelists. We having Loken Sharma sir, Vimal Sharma sir, Anil sir, and Dr. Sudhir Bhandari sir. If anybody having question, they can ask me. Several questions. Rachel, please come in.
Yes, sir.
Rachel, you
Sir,
can ask the
actually,
questions to our panelists.
we have a question from the audience. The question that has
Okay.
come is how to overcome the mental stress during these difficult times.
Oh,
How to overcome the mental stress during these difficult times. So I think Dr. Vimal Sharma sir can take it up first.
Right. So how to overcome
Mental
stress,
during these times.
mental stress during difficult time. Right. Okay. I think Mr. Yadav already highlighted how to correct your thinking process. But I think I will probably give more practical tips. The first thing, and this is one of the things which I share with I have shared with in many occasions, is that the first thing is be active. So you continue with exercise, walking, running, jogging, etc. It's important. The second thing you do is connect to people who you are close, and you don't have to be physically in physical proximity, but you can connect through video conferencing. You can have regular communications and share your feelings and thoughts with people who you are close to. So that's second thing. The third thing is that God has given us plenty of time at present due to this, keeping distant and working from home or whatever. So utilize that time in learning new things and look around and appreciate what's going on around you, which is beautiful, nice. And if you have some intention or inclination, then try to help people who need some help, or give something, give smile to other people. And if you can do all of these, then I think stress wouldn't really come near you. Does that help? So I can reiterate, you be active, connect, keep learning, take notice of nice things around you, and give. So try to remember these five, what you call, 5 mantras.
Thank you, sir. So I think the question is pretty much answered. However, we could move to Dr. Sharma sir. Anil Sharma sir. Sir, please unmute.
Dr. Vimal Sharma nailed it, and he just told us how to deal with the stress. I will add a couple more things. One is, talking to family members, friends, all the positive people in your life, try to talk to them. If you have burned the bridges, this is a time to rebuild those bridges. I'm a big supporter of working out, be it a cardiovascular or weight training. Either kind of exercise helps. And I know that Dr. Lokendra Sharma has taken that initiative and started a pretty nice group in Jaipur where they go for trekking on the weekends. And these are like pretty intense trekking. So exercising in my book, goes like on the top. Communication with people and all the other points Dr. Sharma has said. Also, preparation is always good. I mean, that's how we deal with problems. If you're prepared for what's coming your way, you will be better able to handle those situations. And stress is a general term. It's a broad term. It could be financial stress. It could be work-related stress, relationship issues. But in any kind of a stressful situation, these pointers will help you. So I will add, two more things on Dr. Vimal Sharma's 5 things. So now we have 7 mantras here.
Thank you, sir. Dr. Lokendra Sharma, sir, you have anything to add? Sir, please unmute yourself.
Unmute.
So
Sir,
basically, जो भी डॉक्टर विमल एंड डॉक्टर अनिल ने सजेस्ट किया, तो इसी चीज को कोप अप करने के लिए वी ऑनबोर्ड आवर स्टूडेंट फॉर रनिंग एंड फिजिकल एक्टिविटीज. वी आर ऑर्गेनाइजिंग events for trekking, running and cycling events with students and with our friends and relatives.
Sir, one thing, sorry, I'm interrupting you, sir.
Yes.
Sir, you were telling me that self-harming initiative एक project पे जिस पे अनिल सर, विमल सर काम कर रहे हैं, सुसाइड एक बहुत बड़ा इशू है हमारे इंडिया में. नॉट इवन इन इंडिया बल्कि ऑल ओवर वर्ल्ड में हर 40 सेकंड में डेटा कहता है कि एक आदमी सुसाइड करते हैं. और अगर जिसको देखा जाए तो 1 ईयर में 8 लाख पीपल सुसाइड कर लेते हैं. इंडिया में भी बहुत ये नॉर्मल हो गया. स्टूडेंट हो या फार्मर्स हो या कोई भी मतलब बिजनेसमैन हो, आज के टाइम पे जिस तरह से कोरोना आया है और लोगों के अंदर जो स्ट्रेस बढ़ा है, तो 40 से 50% साइकेट्रिक इश्यूज बढ़ गए. तो ऐसे में मैं विमल सर से भी और अनिल शर्मा सर से भी मैं जानना चाहूँगा कि क्या एप्लीकेबल हो सकता है इसमें, किस तरह से हम चीज़ों को ठीक कर सकते हैं, लोगों को जो सीरियस इशू है उसको कैसे हम ओवरकम कर सकते हैं, जो आज के टाइम पे खासकर कोविड में स्ट्रेस एंजाइटी फोबिया बढ़ा है लोगों का. सर, तो ऐसे में कैसे हम लोगों को किस तरह के टेक्निक्स के थ्रू या क्या करना चाहिए कि लोग अपने स्ट्रेस से ओवरकम कर सके, अपने एंजाइटी से, डिप्रेशन से ओवरकम कर सके.
If I may start, मैं आपको हिंदी में बता देता हूँ.
Sir, actually yes sir, some audience are also they are messaging me कि थोड़ा हिंदी में भी रहे तो.
हाँ, मैं हिंदी में ही बोलता हूँ. सुसाइड एक बड़ा इश्यू है, बड़ा कॉम्प्लेक्स इसके कॉजेज होते हैं. तो इसको सिंप्लीफाई करके और 1 या 2 आंसर तो नहीं हो सकते. पर कुछ एक चीजें हैं जो जिससे हम अवेयर कर सकते. पहले तो पब्लिक को अवेयर करना पड़ेगा कि भाई कोई भी इस रिस्क पे हो सकता है, जिसको निराशा हो सकती है, जिसको ये लगता है कि जीने का कोई मतलब नहीं रहा. उसके कई कारण है कि आपका कोई भी लॉस हो, सिग्निफिकेंट लॉस जब होता है किसी भी तरह का, तो इस तरह की निराशाएं ज्यादा बढ़ती है. कॉमन सेंस की बात है, इसमें कोई बहुत एकेडमिक बात नहीं है. और जब ये लगता है कि मैं अकेला हूँ, मेरी दुनिया में कोई नहीं है, तो और ये लगने लगता है कि इससे अच्छा तो मैं यहाँ से चला जाऊं. या अपने आप को खत्म कर लूं, इस तरह की फीलिंग्स होती हैं। तो सबसे इम्पोर्टेंट चीज है कि जब भी कभी किसी में निराशा की, बहुत ज्यादा निराशा की बात आए, तो वो अपनी बात को शेयर करें, चाहे फैमिली से, चाहे प्रोफेशनल से, चाहे किसी से भी जिसमें उनको कॉन्फिडेंस है। और अगर फैमिली और फ्रेंड्स और एम्प्लॉयर्स और आसपास के लोगों की ये जिम्मेदारी है कि अगर कोई भी आदमी अगर इतना हताश है, निराश है, तो उसको लाइटली नहीं ले। इमीडिएटली हमारा रिएक्शन होता है, करे क्या तू इस तरह से क्या सोचता है, कोई सोचने की बात है क्या है, वो थोड़ा डिसमिसिव एटीट्यूड हो जाता है। ये बहुत इम्पोर्टेंट, कोई भी आदमी अगर ये कहता है कि मुझे लगता है कि क्या फायदा जीने का, तो अलार्म बेल्स मस्ट रिंग एट दैट पॉइंट इन टाइम। इसको कभी भी, उसको बजाय सांत्वना देने के उसको ये कहो कि बताओ क्या बात है, किस बात से परेशानी है, क्या, उसको बोलने दो, ट्राई टू अंडरस्टैंड कि क्या समस्या है। और उसके बाद यूजुअली क्या है कि जब बहुत सिवियर स्टेट, इस तरह का लो मूड होता है, निराशा होती है, तो फिर सुसाइडल आइडियाज होते हैं। एंड इन एटलीस्ट 50, 60, 70% जो सिचुएशंस हैं उनमें अंडरलाइंग इमोशनल प्रॉब्लम्स होती हैं। इमोशनल प्रॉब्लम्स, मेंटल हेल्थ प्रॉब्लम्स, मेंटल इलनेस, जो भी कुछ कहें आप, उनको इजीली हेल्प किया जा सकता है। तो पब्लिक अवेयरनेस, टेकिंग इट सीरियसली, इंटरवीनिंग इट। और क्या होता है कि सुसाइड एक ऐसा ट्रिकी इशू है जिसमें बहुत फाइन बैलेंस होता है लाइफ और डेथ के बीच में। और उसमें अगर वो ऐसी सिचुएशन है कि जिसमें अगर तिनका का भी सहारा मिल जाए ना, तो दैट कैन मेक ए डिफरेंस। कि आप उस वक्त किसी से कॉल की किसी को, और कॉल में रेस्पॉन्स दिया कि भाई तू वहीं बैठा रहे, मैं तुम्हारे पास आता हूँ। मैं एक एग्जाम्पल देता हूँ। बीबीसी में यहाँ पे एक डॉक्यूमेंट्री थी, तो उसमें क्या, थेम्स रिवर है लंदन में, उसके किनारे पे एक आदमी वो जंप कर रहा था सुसाइड करने के लिए। तो एक निकलने वाला जा रहा था, उसने उसको पकड़ लिया, गिरने नहीं दिया। और गिरने नहीं दिया तो बोले, पूछा क्या कर रहा, बोले मेरा जिंदगी का कुछ मतलब नहीं, मैं आई वांट टू एंड माय लाइफ। तो उसने कहा कि तुम ऐसा करना, जो भी करना करना, चलो एक कप चाय कॉफी पीते हैं पहले। तो वो एक कॉफी में वो घंटे भर बैठे रहे, बातचीत करते रहे। और फिर जो था उसका रास्ते चलने वाला, उसने कहा कि मैं अब घर जाता हूँ। और उसके बाद बात खत्म हुई। 20 साल बाद उसी आदमी का इंटरव्यू बीबीसी ने किया, और वो कह रहा है कि मैं 20 साल से उस आदमी को ढूंढ रहा हूँ जिसने मेरी जिंदगी बचाई, एक कॉफी के कप पे। तो इसलिए इसको बहुत ऐसा, हम कई बार के प्रोफेशनल इतना बड़ा इश्यू बना के ये करते हैं, और छोटी चीज को भूल जाते हैं। भाई उनको उस वक्त इमोशनल सपोर्ट की जरूरत है, और अगर अंडरलाइंग प्रॉब्लम हो तो उसको अच्छी तरह से असेस करके, और उसको राइट काइंड का मैनेजमेंट हेल्प उसको कर दें तो क्या। तो एक इमीडिएट इमोशनल सपोर्ट इज एब्सोल्युटली क्रूशियल। और उसके बाद में पूरी अंडरस्टैंडिंग के बाद कि क्या इश्यूज हैं, उनको फिर सिस्टमेटिकली आप डील करो। फाइनेंशियल है कि लॉस है कि कॉन्फ्लिक्ट एट वर्क है, क्या है, तो उनको आप वो कर सकते हैं। और अंडरलाइंग मेंटल इलनेस है तो उसको आप ट्रीट कर सकते हो आसानी से। तो इतना बड़ा इश्यू नहीं है ये, मेरे हिसाब से तो मेरे ख्याल में 60-70% सुसाइड है वो प्रिवेंटेबल है। हाँ, कुछ एक होते हैं जिनमें आप कुछ भी करो वो नहीं कुछ कर सकते, लेकिन अगर आप एक की भी जान बचा ली तो आपने बहुत बड़ा काम किया।
एग्जैक्टली सर, जान है तो जहान है, ऐसा मोदी जी भी कहते हैं। जी जी सर।
इस बात पे मैं एक बात और कहना चाहूंगा डॉक्टर विमल शर्मा की बात पर। एक आप सब जानते हैं गोल्डन गेट ब्रिज जो है सैन फ्रांसिस्को में, इट्स वन ऑफ द लीडिंग साइट जहां पर लोग जंप करके अपनी जान देते हैं। तो एक पर्सन थे केविन हाइंस जो उस ब्रिज से जंप किया था एंड आई थिंक अभी तक 1 या 2 लोग ही हैं जो बचे थे ही सर्वाइव्ड वो बच गए और उन्होंने अपना पूरा लाइफ इस तरफ डाल रखा है कि जो कोई अगर इतना होपलेस है इतना निराश है कि जो अपनी सुसाइड करने की कोशिश कर रहा है उससे अगर आप आंख मिला के बात भी कर लें यह भी बहुत होता है जैसे डॉक्टर विमल शर्मा ने बोला डूबते को तिनके का सहारा बस यही बात है तो उनकी बहुत अच्छी वेबसाइट भी है psycom psycom.net एंड मिस्टर केविन हाइंस ने अपनी लाइफ इसमें लगा रखी है कि जिससे दूसरे लोगों को सुसाइड करने से बचा सकते हैं सो ओवरऑल पूरे वर्ल्ड में सुसाइड रेट कम हो रही है बट इंडिया में जो रेट है उसकी वो पूरे वर्ल्ड से डिसप्रोपोर्शनेट है अभी इंडिया में कम नहीं हो रही है उसी रेट पर जितना वर्ल्ड में हो रहा है सो हमको एज अ हेल्थ केयर प्रोफेशनल्स हमको बहुत कुछ करना पड़ेगा अभी जैसे यहाँ पर है ना यूनाइटेड स्टेट्स में सुसाइड हॉटलाइंस हैं हर कम्युनिटी में पता है कि सुसाइडल पेशेंट्स के साथ क्या करना है द मोमेंट दे से कि हमको सुसाइडल आइडिएशंस हैं देयर इज अ होल सिस्टम देयर यू नो अनफॉर्चुनेटली इंडिया में वैसा सिस्टम बनाने की नहीं और बनाने की जरूरत है ग्रास रूट लेवल पर थेरेपिस्ट्स की number of psychiatrists per population is really bad in India and countries like Sri Lanka. तो हमको वो increase करना है not just psychiatrists but psychologists, therapists at ground level. And इस time हम टेक्नोलॉजी का यूज कर सकते हैं जैसे टेक्नोलॉजी का यूज करके लोगों को साथ ला सकते हैं इंडिया में बहुत पॉजिटिव है कि हमारी फैमिली सिस्टम अमेजिंग है घर पे लोग हैं सब कुछ है वो प्लस हैं बट कई जगह वो नेगेटिव भी हैं जैसे डॉक्टर विमल शर्मा ने बोला कि कई बार वो बोलते हैं कि अगर बोलते हैं कि मैं ऐसे सोच रहा हूँ मरने की वो बोलते हैं कि नहीं जस्ट बी स्ट्रांग बट जैसे जस्ट बी स्ट्रांग कहने से नहीं होगा आपको उनकी बात सुननी पड़ेगी और कई बार जस्ट सुनने से उनका काफी इमोशनल पेन कम हो जाता है या खत्म हो जाता है
Sir, thank you so much, sir. Sir, you have developed this artificial intelligence and machine learning based some programs. Sir, this question for Anil Sharma, sir, Dr. Anil Sharma, sir.
Yes. So
Yes,
we
sir.
are trying to use some artificial intelligence tools, but right now what we have developed are virtual support groups, and we opened up in India for frontline providers, and we have to get some more people to know about it. You know, only few people have contacted us, but we are planning to open this kind of support system, virtual support system run by professionals, open to general public, not just for COVID, for even managing things like diabetes and emotional aspects of, how to cope with diabetes, cancers, which unfortunately risk of cancer and diabetes are really high in India. So I think in this time, we can take advantage of technology to get to more people. And that's what we are trying to do here as a group.
Okay. I think Rachel had some question. Rachel.
Yes, sir. There was another question from the audience. It was basically, he says he's a PhD scholar and his work has been hugely affected because of this COVID era. And the experimental knowledge, everything has been affected. So sometimes this brings a thought of negativity. So post-COVID-19, how far is the impact on our research work and its quality? And what will be considered during job or postdoctoral selection? Basically, what would be the thought process and mindset of selectors in the next few years for those students who have suffered because of this hard time? So this is a question from a PhD scholar, and he's concerned about his research work and his scope after this COVID-19 era. I think Dr. Vimal Sharma can start with this.
I think it's this question is again sort of has multi-pronged approach to address that. And obviously from the authorities, the universities, they have to ensure that their students' welfare is taken care of. That includes, their courses, research work, whatever. If there is an interruption, then they should be allowed to postpone till conditions are right. So I think that's more at a sort of strategy and policy level from the university. But the second issue is that if it has affected this particular person adversely in terms of feeling bit, I think what you're describing is feeling a bit down and bit worried about what's going to happen. Now, at this point in time, probably the counseling services you have could support that person to alleviate these anxieties and fear. And if that carries on, and say if this person develops a mental health problem, whether it is depression, anxiety, whatever, then again, my view is to use non-medical techniques to overcome that through psychological therapies. Obviously, I can stress again that physical activity, exercise, has impact, and this is evidence-based impact both on anxiety and depression. Therefore, one should carry on with regular physical activities. It's a substitute to anti-anxiety and antidepressant medication. But if things get out of hands and even after 3-4 weeks, nothing works, then maybe somebody could make an assessment whether the depression is significant enough to receive some kind of treatment, short-term treatment through antidepressants. And I can assure you that antidepressants, they are reasonably safe, they are non-addictive, and they work very well. And depression is one of the most common mental conditions people experience. It's very common. And I think the other issue is that in all mental disorders, this is again based on evidence, they start at younger age than what people believed in the past. And being in university, that's the sort of vulnerable age where you may develop or even if there is no stress, you may experience mental health problems. Therefore, sometimes these added stress aggravate the situation, make the condition worse. And I think people shouldn't really shy away in accepting assessment and help. And I think this is one of the things is linked to stigma that mental health problems is synonymous to weakness. That's not the case. Any one of us can have mental health problems. It's not a big deal. And there are plenty of ways to assist these people. So just being aware of the fact that if I have a problem, the help is available, get the right kind of help. And I think it's better to be reassured if you don't have mental illness, that at least somebody has made an assessment and said you don't have mental illness, at least that worry is over.
इसमें मैं कुछ ऐड करना चाहूँगा कि ये इश्यूज रिसर्च का, पीएचडी का एंड एमडी थीसिस का इशू हमारे यहाँ भी सब जगह ये प्रॉब्लम आ रही है बिकॉज ऑफ कोविड. नो केस रिक्रूटमेंट ऑफ रिसर्च स्टूडेंट्स और एमडी स्टूडेंट्स इज देयर. तो यूनिवर्सिटीज़ और एमसीआई और जो भी गवर्निंग बॉडी हैं वो सभी रिलैक्स करने के मोड में है, जैसे कि 12th के एग्जाम और 10th और इनके एग्जाम्स में हुआ, उन्हीं को रिलैक्स करने के मूड में. तो दे आर ऑल इन फेवर ऑफ स्टूडेंट्स. ये सारा कुछ डिसीजन होगा उनके फेवर में होगा बिकॉज ये जो कोविड पीरियड है ये सभी के लिए सेम सिचुएशन क्रिएट कर रहा है. तो उनको चिंता करने की जरूरत नहीं है पीएचडी स्टूडेंट्स या किसी भी स्टूडेंट्स को, और ना आइदर ऑफ जॉब की चिंता करने की जरूरत नहीं है और आइदर ऑफ वर्क एंड रिसर्च एंड स्टडी की चिंता करने की जरूरत नहीं किसी भी तरह के कोई स्टूडेंट्स. थैंक
यू. ये एक सवाल है लोकेन सर से. सर आपने बताया था ग्लोबल मेंटल हेल्थ असेसमेंट टूल्स के बारे में, जीमैट. थोड़ा सा सर जो हमारे स्टूडेंट्स आईआईटी के स्टूडेंट्स हैं या जो बाकी लोग हैं जो टीचर्स हैं या कोई फैमिली से बिलोंग करता है, पेरेंट्स हैं, तो ये जो जीमैट है वो उन लोगों को कैसे हेल्प कर सकता है? आज के जो कॉन्टेक्स्ट है, जो कोविड-19 रिलेटेड इश्यूज है, उसमें जीमैट कैसे हेल्पफुल हो सकता है?
इसमें मैं चाहूंगा कि पहले डॉक्टर विमल आंसर दे, फिर मैं उसमें ऐड ऑन करता हूँ। डॉक्टर विमल आंसर देंगे
क्योंकि ये काफ़ी इंटरेस्टिंग है।
नहीं,
जिस तरह से इसके जो पैरामीटर्स मैंने देखे, तो सर इसका हेल्प कैसे ले सकते हैं आम लोग जो हैं, जो नॉर्मल पॉपुलेशन है?
हाँ ठीक है यादव साहब, पहले तो मैं सजेस्ट करूँ आप डाउनलोड करें अपने कंप्यूटर पे और यू गो थ्रू, क्योंकि आप काउंसलिंग सर्विसेज, आई थिंक इट इज इम्पोर्टेंट टू बी अवेयर ऑफ। तो अभी तक तो ये है कि इसका जो मेन इंटेंशन है, जैसा डॉक्टर लोकेंद्र ने बताया, कि ये फ्रंट लाइन हेल्थ वर्कर्स को मेंटल हेल्थ ट्रेनिंग के काम में ले रहे हैं, और वो इसको यूज करें तो वो आइडेंटिफाई कर सकते हैं किस तरह की प्रॉब्लम्स हैं। तो इसमें क्या कि जो सवाल ये पूछते हैं, सीधा सा सवाल है कि आप कैसे हैं, पिछले दिनों किसी तरह की परेशानी है कि नहीं, या आपके घर में कोई परेशानी, या आपके एनवायरनमेंट में, काम पे, फैमिली में किसी तरह का प्रॉब्लम है, या कभी किसी तरह का ट्रॉमेटिक एक्सपीरियंस आपको हुआ। उसके बाद में फिर जो करंट सिचुएशन है उसमें पूछते हैं कि आपको चिंता फिक्र रहती है, कभी घबराहट होती है, मन कैसा रहता है आपका, नींद कैसी आती है, चीजों में ध्यान लगने की शक्ति है कि नहीं, या आपको किसी शारीरिक बीमारी का डर तो नहीं है, या आपको किसी चीज का डर या भय तो नहीं लगता, फोबिक, कि आपको बार बार चेक करने की आदत है क्या, या फिर आपको कोई अजीब से ख्याल आते हैं, आपकी सोच विचार उलझ तो नहीं जाते, तो इस तरह, या आपकी याददाश्त नहीं है, कि आप शराब पीते हैं, कि आप दवा लेते हैं, कि आपको स्ट्रेस है, स्ट्रेस से आपको अजीब से सपने आते हैं कुछ। तो ये सारी चीजें कुल मिला के जितने भी मेंटल डिसऑर्डर्स हैं, इसको 15 मिनट में आप सारी चीजों को कवर करके और ये आइडेंटिफाई कर सकते हैं क्या मेंटल हेल्थ प्रॉब्लम है। अगर थोड़ा सा मैं एक्सटेंड करूं, मेरा मानना है, मेरा इंटेंशन है कि इवेंचुअली मॉडर्न वर्ल्ड में अपनी हेल्थ एंड वेल बीइंग है ना, लोगों को अपने आप मैनेज करने के लिए हेल्प करनी चाहिए प्रोफेशनल्स को हमें। और इवेंचुअली ये, हालांकि इट्स अ बिट फ्राइटनिंग फॉर डॉक्टर्स एंड नर्सेस अपने देश में, पर मेरा इंटेंशन ये है कि अगर हम एम्पावर करें लोगों को कि वो आइडेंटिफाई करके बगैर किसी डर के स्पेशलिस्ट से या जो भी फ्रंट लाइन वर्कर्स हैं उनके पास आए कि भाई मेरे को लगता है कि मेरे को एंजाइटी या डिप्रेशन है, आप इनको देख सकते हैं। इन अदर वर्ड्स, इसी को जो ग्लोबल मेंटल हेल्थ असेसमेंट टूल हो, इसको सेल्फ असेसमेंट टूल बनाने में लगा हुआ हूँ मैं अभी, ताकि जैसे आप यूनिवर्सिटी स्टूडेंट्स को सबों को कह दो भाई तुम अपना अपना देख लो, अगर तुमको लगता है कि कोई तकलीफ है तो वो अपनी खुद की रेटिंग्स खुद का आइडेंटिफाई करके, और वो जो टूल की जो एल्गोरिथम है उससे ये आउटपुट हो जाएगा कि आपको डिप्रेशन है, कि एंजाइटी है, कि आप बिल्कुल ठीक है, कोई किसी तरह की तकलीफ नहीं। उसके बाद फिर वो आप काउंसलिंग सर्विसेज से, और आप फिर उनको डिटेल असेसमेंट करके पता कर सकते हैं कि उनको किस तरह की हेल्प चाहिए। तो ये मेरे ख्याल में 15-20 साल लग जाएंगे माइंड सेट को इस तरह करने का। लोग बाग ये सोचें कोई डॉक्टर की बजाय हम खुद ही क्यों नहीं आइडेंटिफाई कर लें। एंड वो ये मेरे ख्याल मेंटल हेल्थ नहीं, फिजिकल हेल्थ को भी अप्लाई करता है कि आप ब्लड प्रेशर है, डायबिटीज है, तो काहे को आप डॉक्टरों को परेशान करते हो, आप अपने आप ही मैनेज करो।
हाँ, जो कई बार स्टिग्मा होता है सर मेंटल हेल्थ को लेकर के, लोग अप्रोच नहीं करते, खासकर इंडिया में बहुत बड़ा इशू है कि लोग छुपाते हैं बहुत, जब बहुत ज्यादा सीरियस इश्यूज होते हैं उसके बाद वो जाते हैं, मतलब 4 स्टेज के बाद उनको ज्यादा परेशान होना पड़ता है। तो मुझे लगता है कि जीमैट कैन बी वेरी हेल्पफुल।
इसमें मैं और बताना चाहूंगा,
नॉर्मल लोग हैं
इसमें मैं और बताना चाहूंगा कि लास्ट ईयर आपको ध्यान है तो हमारी विजिट हुई थी आपके यहाँ आईआईटी में, आप लोगों ने इनवाइट किया था गेस्ट लेक्चर। उस दौरान भी हमने जीमैट के बारे में शेयर किया था, और डॉक्टर शिशिर गौड़ हैं उनके साथ हमने सारे स्टूडेंट्स को भी शेयर किया था। उसका पर्पज ये था सभी जने जो है www.gmat.org से ये डाउनलोड कर लें इसको, और उसके क्वेश्चन से गो थ्रू आए और खुद के लिए, अपने रिलेटिव्स, अपने फ्रेंड्स और इनके लिए उन क्वेश्चंस को अप्लाई करके देखें कि वो क्वेश्चंस के कुछ पैरामीटर्स तो ऐसा नहीं है कि बिगड़े हुए हैं किसी के, उन चीज़ों से आप जज कर सकते हैं कि अगर आप जैसे जैसे उन क्वेश्चंस को बार बार देखेंगे, वो इसी तरह की ट्रेनिंग हम हमारे स्टूडेंट्स को भी ट्रेन करते हैं कि, और इवन हमारे जो सिंपल जो पैरामेडिकल स्टाफ हैं, स्टूडेंट्स हैं, वो भी सब उन क्वेश्चंस को देख के जज कर लेते हैं कि यार मुझे कुछ कंपोनेंट एंजाइटी है या कुछ कंपोनेंट डिप्रेशन का है, कुछ कंपोनेंट ये है, इस तरह का जजमेंट बड़ी इजीली कर लेता है। तो ये बहुत अच्छा टूल है, इसको सेल्फ असेसमेंट के लिए काम में ले सकते हैं।
एक मैं इसमें थोड़ा सा लिटिल बिट वार्निंग, हमने सारे देशों में काम किया, या यूके में भी और बाकी इंडिया में भी कई स्टेट्स में, अफ्रीका और साउथ अमेरिका में। तो कुल मिला के ये है कि अभी तक जो फ्रंट लाइन हेल्थ वर्कर्स जो यूज करें ना, उनको थोड़ी सी ट्रेनिंग की जरूरत है। ट्रेनिंग टूल को यूज कर, टूल तो कोई भी यूज कर सकता है, पर अंडर बैकग्राउंड अंडरस्टैंडिंग ना मेंटल हेल्थ के इश्यूज के बारे में, तो वो ट्रेनिंग पैकेज हम ये चाहते हैं कि ऑनलाइन ट्रेनिंग पैकेज कर दें, ताकि ज्यादा से ज्यादा लोग इसको समझ कर और फिर अप्लाई करें, तो एक्यूरेसी उनकी बढ़ जाएगी। नहीं तो मिस इंटरप्रिटेशन भी तो हो जाता है। इसमें 3 चीजें, एक तो क्या पूछें, पर इससे इम्पोर्टेंट है कैसे पूछें सवाल ना, कैसे पूछें, और उसको जो आंसर या जो भी आपका कन्वर्सेशन है उससे कैसे कंक्लूड करें, इंटरप्रेट करें, वो ट्रेनिंग का पार्ट होता है। तो उसमें कई बार गड़बड़ हो जाती, कोई कहे तो स्ट्रेस है, कोई उससे पूछे तो डिप्रेस्ड है, तो डिप्रेस्ड तो आजकल कई चीजों को कंबाइन करके सभी बोलते हैं मैं डिप्रेस्ड हूँ, चाहे वो स्ट्रेस हो, एंजाइटी हो, कुछ भी हो, उसके लिए ट्रेनिंग की जरूरत होती है।
जी, थैंक यू सो मच सर। एक सवाल अनिल शर्मा सर के लिए है। सर इज देयर अनिल सर, डॉक्टर अनिल शर्मा सर?
Anil is not there. You can ask. Can ask. Dr. Kamal can reply, or I can reply.
सर जो अभी खासकर ये स्टूडेंट के कॉन्टेक्स्ट में है सर, ये सवाल जो आर्टिफिशियल इंटेलिजेंस है और एक मशीन लर्निंग बेस्ड जो है एक एप्लीकेशन डेवलप किया गया है, वो कैसे स्टूडेंट्स के लिए बेनिफिशियल है, खासकर जो
हाँ, वो हम डॉक्टर विमल और डॉक्टर अनिल और डॉक्टर शिशिर गौड़ जो आपके आईआईटी के हैं, उनके साथ मिलकर, आपके जो एमटेक के स्टूडेंट, उनके साथ मिलकर जो हमारा डेटाबेस है राजस्थान गवर्नमेंट का और एसएमएस का जो डेटाबेस है, उनमें जो पुराने पेशेंट्स जो भी हमारे पास आ रहे हैं, उनका क्या ट्रीटमेंट चल रहा है, उनकी क्या बीमारी है, क्या चल रहा है, उन सारा डेटा को कंपाइल करके और उनको पेशेंट के टाइप, डिजीज के टाइप, डायग्नोसिस और उन सब बेस पे हम हिस्ट्री के बेस पे हम ये कोशिश कर रहे हैं डेवलप करने की कि उन पुराने जो हिस्ट्री या पुराना जो डेटाबेस है, उस डेटाबेस से बेस्ट आउटकम कैसे निकल सकता है, उस तरह के टूल डेवलप करने की कोशिश करें। और उसके लिए हम पर्टिकुलर डिजीज के कंसल्टेंट्स को हायर करते हैं, और आईआईटी के जो सॉफ्टवेयर इंजीनियर हैं या इस तरह के जो लोग हैं, उनको साथ ज्वाइंटली हम वर्क करते हैं, और थोड़ा हॉस्पिटल का जो रिकॉर्ड है या डिजीज का रिकॉर्ड जो नेट पे अवेलेबल है या और ओवरऑल वर्ल्ड में जो सॉफ्टवेयर पे अवेलेबल है, या जो हमारा फार्माकोविजिलेंस का जो डेटाबेस है अवेलेबल है, उसमें उन सबको यूज करते हैं उसको।
सर वी हैव वन मोर क्वेश्चन, विमल सर, sir is there? When one student is asking what are the opportunities for students in corporate world in this pandemic situation? ये थोड़ा अलग है लेकिन सर
नहीं बिल्कुल ठीक बात।
योर वास्ट एक्सपीरियंस सर। हाँ एग्जैक्ट, ये सवाल आउट ऑफ द कॉन्टेक्स्ट है लेकिन समवन आस्क्ड मी।
नहीं बिल्कुल ठीक बात है, क्योंकि देयर आर 2 क्वेश्चन, इसमें 2 सवाल है। एक तो जो कॉर्पोरेट आईआईटी के हैं, उनको ये है कि फ्यूचर किस तरह का होगा, कॉर्पोरेट फ्यूचर। तो मेरे ख्याल में बेस्ड ऑन, ये तो फ्यूचर प्रेडिक्शन की बात है कि क्या होने वाला है। इमीडिएट जो डिप्रेशन हो रहा है कॉर्पोरेट का ना, वो मेरे ख्याल में ज्यादा देर चलेगा नहीं, धीरे धीरे देयर आर बेटर ट्रीटमेंट फॉर कोविड, देयर आर ये इम्यूनाइजेशन, वैक्सीनेशन और ये सारा हो जाएगा। तो और अगर आप इवन व्हेन यू लुक एट पास्ट पैंडेमिक, जो सब इससे भी ज्यादा खतरनाक पैंडेमिक था 1918 to 1919 स्पेनिश फ्लू का, जिसमें 50 मिलियन पीपल, 5 करोड़ लोग दुनिया में खत्म हुए। उस वक्त जो दुनिया की पॉपुलेशन 1.5 करोड़ तो अपने इंडिया में खत्म हो गए थे उस वक्त। तो और इंडिया की पॉपुलेशन कितनी थी, मेरे ख्याल 20-22 करोड़ होगी, तब 30 करोड़ होगी। तो उसमें से nearly 10% of population was wiped, well 5% population was wiped out। पर हुआ क्या, वो 2-3 साल बाद फिर वापस वही उसी तरह का वो हो गया। तो इस वक्त इतना ज्यादा डिप्रेशन नहीं होगा कॉर्पोरेट वर्ल्ड में, पर यही है कि देयर विल बी न्यू अपॉर्चुनिटीज, इट विल बी न्यू, जहाँ टेक्नोलॉजी और इनका ज्यादा वो होगा। तो अगर जो स्मार्ट स्टूडेंट्स हैं उनको ये देखना चाहिए कि फ्यूचर किस डायरेक्शन में जा रहा है, और उसमें अगर वो अपना टाइम और एनर्जी इन्वेस्ट करें तो यही है कि ये पॉज है मेरे ख्याल में मैक्सिमम अबाउट ईयर एंड हाफ, उसके बाद फिर सडन अपसर्ज होगा डेवलपमेंट में। मैं ऐसे प्रिडिक्ट कर रहा हूँ जैसे कोई ज्योतिष से प्रिडिक्ट कर रहा है।
इसी
सर
में
अभी
मैं
सब प्रिडिक्शन पे ही सब कुछ रुका हुआ है, क्योंकि मेरे को लगता है सब कुछ अनसर्टेन है लाइफ में, कुछ भी सर्टेन
इसमें भी
नहीं
कुछ
है।
ऐड करना चाहूंगा, मैं ऐड करना
जी,
चाहूंगा।
जी,
जैसे अभी सब कुछ ऐसा लग रहा है कि शायद बहुत कुछ का चीज होंगी, लेकिन आप देखो दूसरे जो बिजनेस कर रहे थे वो सैनिटाइजर्स में वर्क करने लग गए, कुछ और लोग मास्क का प्रोडक्शन होने लग गया, मास्क है ना, कुछ लोग कि जो हेल्थ केयर वर्कर्स की जो चीजें उनमें, इसके अलावा जो किट हैं, जो आपके कोविड के जो किट हैं उस पर वर्क हो रहा है, कोविड के वैक्सीन पे दुनिया भर की इंडस्ट्री वर्क कर रही है। तो ऐसा नहीं है कि एक कुछ इंडस्ट्री खत्म हो जाती है तो दूसरी इंडस्ट्री ग्रो कर जाती है, तो ऐसा नहीं है। बहुत बड़ी, जैसे आपकी आईटी इंडस्ट्री बहुत ज्यादा ग्रो कर रही है इस समय, जैसे वेबिनार हो गई, ये हो गई, वर्क टू होम चल रहा है। तो ऐसा नहीं होता कि कोई चीज अगर खत्म हो रही है, जैसे मान लो ट्रैवलिंग या एयरलाइंस अगर खत्म हो रही है तो दूसरी इंडस्ट्री ग्रो कर रही है, लोग उसमें वर्क करना शुरू कर देते हैं, तो ग्रोथ हो ही रही है। ऐसा नहीं है कि किसी को ये सोचने की जरूरत नहीं है कि ये आगे चल कैसा हो जाएगा, और ये तो शॉर्ट पीरियड है, कुछ टाइम बाद सब चीजें नॉर्मल हो जाएंगी, ऐसा नहीं होता।
Sir, one
चीजें
thing
ग्रो
more.
करेगी।
I have one more question. Thank you, sir. Sir, Vimal sir, I think being a psychiatrist, he can give a good answer on this. किसी ने पूछा है सर कि how to handle the relationships. अभी क्या हुआ है कि सब लोग ड्यू टू दिस लॉकडाउन लोग घर में रह रहे हैं, अचानक से सब कुछ बंद हो गया और एक नया ट्रांसफॉर्मेशन फेज आया माइंड और बॉडी का। मतलब जिनको बाहर निकलने का एक आदत था वो अचानक से एकदम सब कुछ स्टॉप हो गया, घर में रहने को हुआ, तो घरेलू हिंसा भी बढ़ गए सर। हेलो सर, तो ही वांट्स टू हाउ टू हैंडल द रिलेशनशिप, क्योंकि बहुत सारे आईटी स्टूडेंट्स है वो हॉस्टल में अपने हिसाब से रहते थे, अभी घर गए हुए हैं, तो वहाँ पे वही चीज़ कैरी करते, क्योंकि रातों रात हैबिट्स बदलती नहीं है, वो लेट उठना, देर तक मोबाइल फ़ोन चलाना, मतलब एक कैजुअल अप्रोच रहता है, और पेरेंट्स कई बार देखें या कभी कभी हॉट टॉक हो जाता है, या बहुत सारे इकोनॉमिकल क्राइसिस आने की वजह से लोगों में मेंटल हेल्थ इश्यूज आने लगे हैं, तो एक दिमाग में से स्ट्रेस रहता है। तो होता क्या है सर कि छोटी छोटी बातों पे लोग इम्पल्सिव हो रहे हैं, गुस्सा हो जा रहे हैं, तोड़ फोड़ मचा दे रहे हैं, तो इसको सर कैसे हैंडल कर सकते हैं रिलेशनशिप इश्यूज जो आ
ये अगर यही सवाल जिनको प्रॉब्लम है उनको मैं उनसे पूछूं कि वो किस तरह से हैंडल करते हैं, और अगर कई लोगों से ये पता लगे वो कैसे हैंडल करते हैं तो उनसे इन चीजों का आंसर मिल जाएगा। ये बड़ा कॉम्प्लेक्स इश्यू है इंटरपर्सनल रिलेशंस, इसमें एक आदमी इन्वॉल्व नहीं, कई लोग इन्वॉल्व होते हैं। फैमिली में तो सारे लोग इन्वॉल्व हो जाते हैं, और वो फिर कई बार ग्रुप्स हो जाते हैं, या कई बार एक दूसरे का एक अगर उसका टेम्पर लूज करता है, दूसरा टेम्पर लूज करता है, तो फिर पहले का टेम्पर उससे ज्यादा लूज होता है। अगर मेरा पर्सनल एक्सपीरियंस है कि कई बार ऐसे सिचुएशन होती कन्फ्रंटेशन की, आप घर में हो या कहीं भी, तो सामने वाला गुस्सा और अगर आप चुप हो जाओ बिल्कुल, उस वक्त somehow you can keep your cool. तो सामने वाले का गुस्सा भी अपने आप ठंडा, ये इमोशनल रिएक्शन है, ये फिजिक्स का रूल अप्लाई करता है कि आप गुस्सा होते हैं तो सामने वाला गुस्सा होता है, आप खुश रहते हैं तो सामने वाला भी खुश होता है, आप अगर उदास होते हैं तो सामने वाले को भी उदासी होती है, इन्फेक्शियस होता है। इसको थोड़ा सा अवेयर करके थोड़ा सा अगर खुद में वो कंट्रोल कर ले उस वक्त, एंड देन सी, वो उससे फिर लर्निंग हो जाती है कि अगर एक बार मैंने कर लिया कंट्रोल और उससे डिफ्यूज हो गई सिचुएशन तो वो हो गई। पर इसमें सिर्फ अपने स्टूडेंट्स की प्रॉब्लम ही नहीं, ये पेरेंट्स की भी प्रॉब्लम, उनको अंडरस्टैंड करना पड़ेगा। क्योंकि हमारे भी बच्चे यूनिवर्सिटी में गए तो हमें शुरू में बड़ी प्रॉब्लम होती थी एडजस्ट होने की। अब हमें लगता है कि शायद वो बच्चों का अप्रोच और एटीट्यूड सही था, हमारा गलत था, वी डिड नॉट कीप अप टू डेट आवरसेल्व्स। तो पेरेंट्स को भी बदलना पड़ेगा, बच्चों को भी थोड़ा सा अकोमोडेट करना पड़ेगा कि भाई ये एकदम तो चेंज नहीं हो सकते पेरेंट्स, पर इनको किस तरह से चेंज किया जाए। तो अगर सिनर्जी हो जाए पेरेंट्स और स्टूडेंट्स में, तो फिर ये सारे रिलेशन, ये जो फैमिली रिलेशंस, इंटरपर्सनल रिलेशंस है, इनकी प्रॉब्लम खत्म हो जाएगी। हालांकि ये प्रीचिंग एक, मतलब आप भाषण देने वाली बात है, जब खुद पे गुजरती है तो बड़ा मुश्किल होता है।
ये
पर एक बार करके
तो सही है सर,
एक बार
ट्रू, बिल्कुल ट्रू।
एक बार करके देखें कि भाई अगर कोई आदमी गुस्से में आता है तो आपको इमीडिएट रिएक्शन होता है गुस्से होने का, उस वक्त अगर आप कंट्रोल कर लेते हैं, इट मेक्स ए ह्यूज डिफरेंस। तो मैं आपको एक एग्जांपल देता हूँ। हमारे नेबर, हमने यहीं पे फैंस लगाए तो उसकी ऊंचाई थोड़ी ज्यादा हो गई थी, तो नेबर को प्रॉब्लम हुई, तो वो आया एकदम आग बबूला होता हुआ, मैंने दरवाजा खोला तो मैंने, वो बोले आपने कैसे लगाए, हमसे पूछा नहीं, ये वो। तो मैं मतलब एक जवाब ये भी दे सकता था कि तू कौन होता है, मैं, हम जो करेंगे वो करेंगे, और यूजुअली यही होता है। मैंने उससे कहा, मन के आप अच्छा पड़ोसी हैं, आप आइए चाय वाय पीते हैं, फिर करते हैं बात, क्या प्रॉब्लम है। तो बोले कि इससे मन की क्या, इससे क्या प्रॉब्लम, बोले मेरे को वो दिखने में ये लाइट में थोड़ी है, तो मन की आप चाहते हैं, बोले इसको आप थोड़ा सा चेंज कम कर लो। मन की इतनी सी बड़ी बात कर ले, आप काहे को परेशान है, कल करवा देंगे। दूसरे दिन चेंज करवा दिया, वो आके फिर फ्लावर और वो लेके आ गए।
एग्जैक्टली कह सकते हैं कि जहाँ प्रॉब्लम है वहाँ सोल्यूशन भी है। कई बार हम जब प्रॉब्लम में फंस जाते हैं तो हम डिस्ट्रक्टिव मोड में चले जाते हैं, जब आप सोल्यूशन मोड में आते हैं तो आप थोड़े कंस्ट्रक्टिव मोड में चले जाते हैं।
इसमें बेस्ट मैसेज ये है कि यू हैव टू चेंज योरसेल्फ। दूसरों से एक्सपेक्ट मत करो कि अपने आप को चेंज करके कूल रहने की कोशिश करो, वो सबसे बेस्ट मैसेज है।
एग्जैक्टली सर। So we are about to finish this. One more question, sir. सर विमल सर से एक सवाल है। हेलो।
हाँ जी।
सर आप अर्बन रूरल हेल्थ जो है उसके आप चेयरमैन हैं, और वर्ल्ड साइकेट्रिक एसोसिएशन जो रूरल हेल्थ है, और जैसे यूएनओ है, डब्ल्यूएचओ है, ये जो तीनों बॉडीज हैं, आज के टाइम पे जो इश्यूज हो रहा है हमारे स्टूडेंट्स के साथ या बाकी नॉर्मल पॉपुलेशन के साथ, तो ये जो बॉडीज हैं जो पूरे दुनिया का ख्याल रखती हैं, वो कैसे हेल्पफुल हो सकती हैं? हाउ दीज बॉडीज कैन हेल्प आवर स्टूडेंट्स? थोड़ा स्टूडेंट्स जो आईआईटी स्टूडेंट्स हैं या बाकी स्टूडेंट्स हैं, उनके लिए कैसे ये सर हेल्पफुल हो सकती हैं बॉडीज?
जैसे कि आज की अपने मीटिंग में सारे सवाल हुए और इनके मुश्किलों का पता लगा मेरे को, तो जैसे WPA, वर्ल्ड साइकेट्रिक एसोसिएशन, ये सारे जो साइकेट्रिक एसोसिएशन सारे कंट्रीज का, उनका कुल मिला के जो एसोसिएशन है दुनिया भर का, वो है। तो इसमें क्या, हम सारे नेशनल ऑर्गेनाइजेशन, जैसे इंडियन साइकेट्रिक सोसाइटी है, या ब्रिटिश रॉयल कॉलेज ऑफ साइकेट्री, या अमेरिकन साइकेट्रिक एसोसिएशन है, तो इन सारे जो नेशनल बॉडीज हैं उनके साथ काम करते हैं। तो हम जैसे कि WPA की मीटिंग साथ इंडियन साइकेट्रिक सोसाइटी को कहेंगे कि भाई इंडिया में IIT स्टूडेंट्स या जनरल स्टूडेंट्स की इश्यूज हैं और इनको एड्रेस करने के लिए हमको कुछ करना चाहिए। तो उन नेशनल ऑर्गेनाइजेशंस के थ्रू देन वी advise, recommend and communicate with governmental bodies जो नेशनल जैसे डिपार्टमेंट ऑफ हेल्थ है इंडिया का या स्टेट्स के, उनको अप्रोच करते हैं कि भाई दिस इज अ बिग इश्यू एंड यू हैव टू डील विद इट। उसमें चाहे रिसोर्सेज, ट्रेनिंग, एक्सेस टू एक्सपर्टीज, ये सारी करें। तो कई बार ये चीजें इनविजिबल होती हैं कि ये क्या कर रहे हैं, पर बिहाइंड द सीन्स ये सारा चलता रहता है इस तरह से। और उसी तरह से फिर नेशनल पॉलिसीज और स्ट्रेटजीज जो बनती हैं, जो फिर फिल्टर होती है ग्राउंड लेवल पे। इस तरह से ये बड़े ऑर्गेनाइजेशंस वो करते हैं। जैसे UN भी अभी कहा कि भाई मेंटल हेल्थ विल बी बिग इश्यू आफ्टर कोविड। और ये कोविड तो अभी तो हम कोविड में प्रीऑक्यूपाई ना, इसका आफ्टर माथ जो होगा उसमें ये प्रिडिक्शन है कि भाई मेंटल हेल्थ could become a sort of big issue, particularly in European and Western countries. मेरे ख्याल में that applies to India as well. तो उसको किस तरह से डील करें, शुरू से ही स्ट्रेटजी इस तरह के हो, रिसोर्सेज इनफ हो, whether it is counselors or training or public awareness or public involvement or whatever. तो इस तरह से behind the scenes through government agencies हम ये सपोर्ट करते हैं। वो डायरेक्ट हेल्प स्टूडेंट्स को नहीं मिल पाती तो उनको लगता है कि लोग क्या करते हैं।
एग्जैक्टली सर। इसी कॉन्टेक्स्ट में एक छोटा सा सर सवाल है, दिस इज लास्ट क्वेश्चन। मेरे पास एक सवाल आया है, कुछ मतलब ये सिमिलर है, थोड़ा सा मैं कस्टमाइज करके सर मैं पूछ रहा हूँ। कुछ स्टूडेंट्स हैं सर, वो बहुत रिमोट एरिया से आते हैं, गांव से आते हैं, लोन लेकर के आते हैं, वो गरीब घर से हैं। इनमें मैक्सिमम पॉपुलेशन जो पॉवर्टी लाइन पे रहती है या मिडिल क्लास है, तो उनके पास इतने पैसे नहीं होते कि वो इतने बड़े लेवल पे चीज़ों को अफोर्ड कर पाएँ, पर फिर भी लोन लेके आते हैं। तो अभी ऐसा पैंडेमिक कंडीशन किसी को नहीं पता था कि ऐसा आएगा, तो उन स्टूडेंट्स के लिए सर कोई आप मैसेज देंगे जो खासकर जो लगातार इस चीज़ को लेकर के ओवर थिंक करते रहते हैं, या कई बार परिवार वाले प्रेशर डालते हैं कि मतलब इसी बच्चे से मेरी उम्मीद थी, अब इस तरह से हो गया है। तो कई बच्चे कि उनकी इंटर्नशिप रुक गई है, कई सारे बच्चे हैं जो होल्ड हो गए हैं, वो प्लेस्ड होकर के चीज़ें होल्ड कर दिया कंपनी ने। तो ऐसे में सर एक क्या होप लेके चल सकते हैं स्टूडेंट्स, पेरेंट्स?
इसमें मेरे ख्याल में सबसे पहले एक तो यूनिवर्सिटी पेरेंट्स को थोड़ा सा रीअश्योरेंस और सपोर्ट, इमोशनल सपोर्ट उनको देने की, क्योंकि कई बार प्रेशर पेरेंट्स की तरफ से भी पड़ता है, भाई तुम कुछ करो या कुछ न कुछ करना चाहिए, तुम्हारे लिए इतने पैसे खर्च किए, ये किया वो किया। उसकी जगह पेरेंट्स को कहना चाहिए कोई बात नहीं, तुमने जो भी कुछ किया, जब टाइम होगा तो सब ठीक हो जाएगा। पेरेंट्स हैव टू बी रीअश्योरिंग, दे हैव टू बी विद स्टूडेंट्स। तो आप यूनिवर्सिटी की तरफ से पेरेंटल एजुकेशन, उनके ग्रुप या डिस्टेंट कम्युनिकेशन करके उनको कहो कि भाई अभी आप इनको सपोर्ट करो बजाय कि प्रेशर करने के। और ये अगर पेरेंट्स सपोर्ट कर लेंगे ना, तो आधी से ज्यादा प्रॉब्लम तो वहीं पे खत्म हो जाएंगी, क्योंकि यंगस्टर्स उनमें काफी एनर्जी, काफी एंथुजियाज्म, काफी रिस्क टेकिंग टेंडेंसी होती है। तो उनको चाहिए होती है सपोर्ट की जरूरत। सपोर्ट का मतलब इमोशनल सपोर्ट, फाइनेंशियल सपोर्ट की भी नहीं। फाइनेंस की है ये एक बड़ा इश्यू है, इसका कुछ न कुछ मेरे ख्याल में बिगर सोल्यूशन होना चाहिए कि जिनको दोज हु कैन सपोर्ट दीज पीपल, जिनके डेट है कि कुछ है, या फिर जिनसे डेट ले रखी है, उनकी रिस्पॉन्सिबिलिटी भी हो सकती है कि भाई अभी मत करो। मैं हालांकि कहना नहीं चाहता, हमारे पास जयपुर में घर है, तो उसमें किराएदार रहते हैं, वो कहते हैं कि भाई हमारा तो अभी जॉब खत्म हुआ, उन्हें चिंता नहीं करो, तुम रहो जब तक रहो, कोई दिक्कत की बात नहीं है। तो उनका आधा टेंशन तो वहीं खत्म हो गया।
एग्जैक्टली सर, बिल्कुल।
अब उनको खुद की रिस्पॉन्सिबिलिटी लेके और जब भी काम लगेगा, तो इसलिए जो लोग अफोर्ड कर सकते हैं, मेरे ख्याल में उनकी थोड़ी सी मॉरल रिस्पॉन्सिबिलिटी होती है टू सपोर्ट दोज हु आर लेस वेल ऑफ। तो इस तरह का कुछ मूवमेंट आप चला सकते हैं कि भाई
डेफिनेटली
those who can support those who are in debt। वो ये नहीं कि वो पैसा लेके भाग जाएंगे, once things improve they will repay that back।
Thank you so much sir. Loken sir, one more last question for you, Loken Sharma sir, because Vimal sir, Loken sir, Anil sir सब क्लब होकर के मेंटल हेल्थ रिलेटेड बहुत अच्छे अच्छे काम कर रहे हैं। तो ये एक अच्छा मुझे लगता है टाइम है, और ये बहुत क्रूशियल टाइम है जहाँ पे लोगों को एक सपोर्ट की ज़रूरत है। जैसे सर ने कहा कि तिनके के बराबर अगर जो डूबते को तिनके का सहारा मिल जाए तो उसके लिए बहुत होता है। तो आई थिंक ये जो प्रोग्राम है, इसमें जो भी आप एक्सपर्ट आंसर्स देंगे तो वो एक तिनके के समान होगा, जो एग्जैक्टली लोगों को एक पॉजिटिव व्यू डेवलप करेगा, उनके लिए एक होप लेकर के आएगा, संजीवनी का काम करेगा, मैं कह सकता हूँ। सर शुरू में सर ने बताया, लोकेन शर्मा सर, अरे देर सर। हाँ सर जैसे आपने बताया था कि आप गूगल ऐप यूज़ कर रहे हैं मेंटल हेल्थ इश्यूज और साइकोसोमेटिक इश्यूज से रिलेटेड, क्योंकि आप और विमल सर और अनिल सर क्लब होके मेंटल हेल्थ रिलेटेड काम कर रहे हैं। तो आज की जो एक 3-4 कॉमन प्रॉब्लम है, स्ट्रेस है, एंग्जाइटी है, फोबिया है, डिप्रेशन है, ये बहुत कॉमन है इश्यूज हैं और बहुत तेजी से बढ़ भी रहे हैं, खासकर स्टूडेंट्स में बहुत जा रहा है। तो सर स्टूडेंट्स के लिए आप ऐसा क्या कर सकते हैं जो अपने वो स्किल को इन्हांस कर सके? और कुछ आपने कहा था गूगल मैप एप्लीकेशंस के हेल्प से आप कुछ एसेस कर रहे हैं और हेल्प करने की कोशिश कर रहे हैं, तो थोड़ा सा ब्रीफ में सर बता दीजिएगा, बिकॉज वी आर ऑलरेडी रनिंग शॉर्ट ऑफ टाइम।
जैसे जीमेट के जो क्वेश्चंस हैं, एक तो सिंपल तरीका है कि उसको आप नेट से डाउनलोड करें और अपने लैपटॉप और मोबाइल में उसको यूज करें और उसको असेस करने की कोशिश करें। दूसरा, इसी तरह की जो एप्लीकेशन हम डेवलप करते हैं, जैसे डिप्रेशन, एंग्जाइटी, इस समय कोरोना, फोबिया, और ये सारा जो क्वेश्चन, उनके क्वेश्चंस हम डिजाइन करके और गूगल फॉर्म के थ्रू बच्चों को हम शेयर करते हैं और कोशिश करते हैं कि बच्चे उनको रिप्लाई करें, उनको मोटिवेट करते हैं बच्चों को कि वो रिप्लाई करें, उनको ब्रॉडकास्ट से पर्सनली भेज के। उससे हम थोड़ा, हमें आइडिया लगता है कि कौन बच्चे को क्या इशू हो सकता है, उसको फिर हम काउंसलिंग और उसके लिए हम कंसल्टेशन देने की कोशिश करते हैं। इस तरह से हम कोशिश करते हैं
मतलब पहले आइडेंटिफाई द प्रॉब्लम, देन वी सी कि हाँ प्रॉब्लम है, तो फिर हम उसको सपोर्ट देते हैं,
टेलीकॉन्फ्रेंसिंग, टेलीवीडियो कॉन्फ्रेंसिंग से कंसल्टेशन देने की कोशिश करते हैं।
जी सर, थैंक यू सो मच सर।
लक्ष्मण जी, एक चीज मैं पूछूं आपसे
सर?
ये स्टूडेंट के हेल्थ एंड वेल बीइंग एंड पर्टिकुलरली मेंटल हेल्थ, इनका अगर कोई इवेल्युएशन प्रोजेक्ट या हमारी यूनिवर्सिटी से ग्लोबल फंडिंग के थ्रू हो, तो आपकी यूनिवर्सिटी उसमें पार्टिसिपेट करना चाहेंगे?
बिल्कुल सर, बिल्कुल, इस पे हम लोग डिस्कस करेंगे और पार्टिसिपेट बिल्कुल करना चाहेंगे सर। अगर जो इस तरह के प्रोग्राम्स जो स्टूडेंट्स वेलफेयर के लिए है और पब्लिक डोमेन में जो कुछ पॉजिटिव और कंस्ट्रक्टिव हो सकता है, तो डेफिनेटली इसके लिए हम
नहीं,
लोग
वो
आगे
काफी
आएंगे।
इलॉबरेट होगा, बट विद द इंटेंशन टू इम्प्रूव हेल्थ एंड वेल बीइंग ऑफ स्टूडेंट्स एंड यूथ।
लक्ष्मण जी, मैं कुछ ऐड करना चाहूंगा। हाँ बिल्कुल सर, ये बहुत ही इंटरेस्टिंग पॉइंट है और हम लोग उसके लिए मतलब फंडिंग के लिए हम लोग फिर फर्दर किसी भी ऑर्गेनाइजेशन से कांटेक्ट भी कर सकते हैं।
नहीं, मैं इसके बैकग्राउंड की एक वो NIHR से फंडिंग की, इनकी क्या होती है कि हर 6 महीने में वो बिड के लिए वो करते हैं, तो मेरे को, मैं जानता हूँ कभी 2-1 महीने में एक आने वाली है फंडिंग के लिए। तो उसमें क्या होता है कि इंटरनेशनल फंड, वो ऑर्गेनाइजेशंस, दे वर्क इन कोलैबोरेशन। जैसे हमारी यूनिवर्सिटी इंडिया में 1 या 2 यूनिट, जैसे हम जयपुर से काम कर रहे हैं, वैसे ही अगर दूसरे स्टेट में हो, तो जैसे आपकी यूनिवर्सिटी से करें।
बहुत
तो
बढ़िया। मैं आप जैसा कहेंगे उस तरीके से हम लोग प्लान कर सकते हैं। और इसमें तो हम लोगों का एक बहुत स्ट्रॉन्ग स्टूडेंट काउंसलिंग सर्विस है, जिसमें अराउंड 10 फैकल्टी मेंबर्स हैं जो कि इसके लिए पर्टिकुलर अपना समय डेडिकेट करते हैं। और काउंसलिंग सर्विस में एक पर्टिकुलर वेलनेस का जो ग्रुप है उसके अंदर 3 to 4 फैकल्टी मेंबर्स हैं जो वेलनेस को डील करते हैं। मतलब हम लोगों ने लक्ष्मण जी ने एक वेलनेस लैब भी डेवलप किया है और उस विषय में हम लोगों का बहुत इनपुट है। तो इस तरीके की अगर कोई भी एक्टिविटी होगी तो बहुत ही इंटरेस्टिंग रहेगी।
नहीं ठीक है, तो एक बेसिक चीज तो लोकेंद्र इनको जीएमएट का ट्रेनिंग का ही कर सकते हैं एक तो।
मैं इनको लिंक भेज रहा हूँ जीएमएट का और ये लोग डाउनलोड करें।
एक बार आप सबको जीमेट का लिंक भी शो कर दीजिए।
हाँ हाँ, आप लोग डाउनलोड पर वो ये है कि एक बार ट्रेनिंग का अरेंज कर लेंगे अपने।
हाँ।
तो ट्रेनिंग के बाद उसको यूज कर सकते हैं।
ट्रेनिंग वैसे ऐसा करते हैं, वीडियो कॉल से किया जा सकता है इस समय कोविड पीरियड में। अदरवाइज तो
कल मैं तो यहाँ पे मैनचेस्टर के पास हूँ, लंदन में ट्रेनिंग के लिए यहीं से बैठा हुआ ट्रेनिंग करेंगे। कल हमारे होम ऑफिस और पब्लिक हेल्थ इंग्लैंड के साथ में मीटिंग है कि वो सारे रिफ्यूजी, तो अब सारा आधा से ज्यादा काम तो वीडियो कॉन्फ्रेंसिंग के थ्रू ही होगा।
तो वो यहाँ पॉसिबल है वो करें।
हाँ, वो पब्लिक हेल्थ इंग्लैंड भी जीएम हेड को आगे लेना चाह रही है यहाँ पे ना। तो वो कल इसी की मीटिंग, इसी कॉन्टेक्स्ट में पूछ रहा था कि जो फ्यूचर के प्रोजेक्ट्स हैं उसमें कोलैबोरेशन। तो इंडिया में जो मेन अपना की पर्सन है वो लोकेंद्र हैं, डॉक्टर लोकेंद्र। तो इनके थ्रू ही सारा कम्युनिकेशन होगा फ्यूचर में।
जी जी सर, बिल्कुल। And one more thing for students of IIT BHU, उनके लिए सर 2 अनाउंसमेंट है। If you allow me sir, तो please I want to give this announcement to students. Am I audible? हाँ, जो हमारा स्टूडेंट काउंसिल सर्विसेज का मोबाइल नंबर है, स्टूडेंट चाहे तो नोट कर सकते हैं। इस पर मुझे व्हाट्सएप कर सकते हैं। इफ़ दे आर फेसिंग एनी इश्यूज, एनी काइंड ऑफ मेंटल हेल्थ इश्यूज, मुझसे आप शेयर कर सकते हैं। नंबर है 7524053214। आई रिपीट 7524053214। ये SCS वेलनेस का नंबर है। आपको कोई इशू हो रहा है तो इस पर आप मुझे व्हाट्सएप कर सकते हैं। Apart from this, you can note down my number 9696384984. किसी भी स्टूडेंट को किसी तरीके की प्रॉब्लम आ रही है, so now I would like to call Shishir sir for vote of thanks. Hello. Now I would like to call Shishir sir, Dr. Shishir Gaur sir, for vote of thanks.
I think Dr. Shishir is not there.
Okay. So let me connect to sir once. Sir, let to sir. एक्चुअली सर का मोबाइल नंबर अभी मोबाइल फोन स्विच ऑफ हो गया है, बैटरी ड्रेन हो गई है। तो
vote of thanks can you can give vote of thanks.
I think sir is coming in, sir. Let me once connect once more. Just so Loken sir there, Vimal sir, thank you so much sir. It's really very interactive session और बहुत अच्छा लगा। आप इतने डाउन टू अर्थ और इतने आराम से आपने सारे सवालों का जवाब दिया। लोकेन सर, विमल सर से मेरी पहले भी बात हुई थी और सबसे अच्छा लगता है कि जब आपको कोई बैठ के कंसोल करे, आपकी बात को सुने, और वो जितना बेहतर तरीके से सुनता है उतने अच्छे से वो रिप्लाई भी करते हैं। और यही चाहिए होता है कि आपके साथ कितनी अच्छे से किसी की कनेक्टिविटी बैठ रही है, कितना आप कंफर्टेबल है किसी के साथ। और ये कंफर्ट आप सबके साथ लगी। लोकेंद्र शर्मा सर जब भी मैं कॉल करता था सर रिप्लाई करते थे। विमल सर से मेरी पहले भी बात हुई थी और आज भी इतने धैर्य के साथ, इतने पेशेंस के साथ सारे सवालों का जवाब दिया। वो चाहे साइकेट्री के, आउट ऑफ साइकेट्री था, फिर भी सर ने अपने एक एक्सपीरियंस के थ्रू बहुत अच्छे से जवाब दिया। आई होप सबको अपने अपने सवालों का जवाब मिल गया होगा। और मैं थैंक यू करना चाहता हूँ सर आपको, अपने पूरे आईआईटी फैकल्टी की तरफ से, स्टूडेंट्स की तरफ से, डायरेक्टर सर की तरफ से, जो हमारी वेलनेस की टीम है उनके तरफ से। थैंक यू सो मच, यू हैव एक्सेप्टेड आवर इनविटेशन। और 3-3.5 घंटा पता ही नहीं चला कैसे गुजर गए। तो इसकी टॉक आगे फर्दर चलते हैं, आप लोगों को सेशन मिलता रहे और हम इसी तरीके से स्टूडेंट के लिए जो भी वेलफेयर हो सके, उनके मेंटल हेल्थ को और ज़्यादा बेहतर कर सके, इस तरह के हम कोशिश करेंगे। प्रोग्राम को हम ऑर्गेनाइज करते रहें। जो हमारी पूरी टीम है, जो स्टूडेंट्स, खासकर पार्थ, नीरज, आई हैव लिस्ट ओवर हियर, नीरज, पार्थ, रिचल, नवीन कुमार, मिस्टर अंकित जायसवाल, अवनी मालवीय, बी राजश्री रेड्डी एंड अनमोल, इन सभी को बहुत बहुत थैंक यू, धन्यवाद। वी रामन सर जो आज हमारे प्रोग्राम के ऑर्गेनाइजिंग कमेटी चेयरमैन हैं, और डॉक्टर शिशिर गौर सर, उसके अलावा रुचिर सर, सुगदा मैम, और बाकी जितने स्टाफ हैं हमारे आईआईटी बीएचयू के, जो डायरेक्टली इनडायरेक्टली इसमें पार्टिसिपेट किया, हमें मोटिवेट किया, ये प्रोग्राम आज उसकी वजह से सफल हो पाया। तो आप सभी को बहुत सारा थैंक यू। थैंक यू विमल सर। हम आपके साथ कनेक्टेड रहेंगे और बहुत सारी चीज़ें आपसे सीखते रहेंगे, और जो भी स्टूडेंट्स को हेल्प हो सके, लोकेंद्र सर से, विमल सर से, अनिल शर्मा सर से, रमा यादव सर से, बिल्कुल हम टाइम पे इस तरह के कॉन्फ्रेंसेस ऑर्गेनाइज करते रहेंगे, और जो भी मेंटल हेल्थ के लिए हेल्पफुल हो सके वो हम करेंगे सर। तो थैंक यू सर, थैंक यू फॉर ज्वाइनिंग अस। थैंक यू सर, गुड नाइट सर। ओके, सबको नमस्कार, थैंक यू, गुड नाइट। नीरज।